all of you. And to say that we are thrilled to see you is an understatement. Ladies and gentlemen, it's a wonderful day, and I would like to once again welcome each one of you to the 5th India IVF Summit and Awards, organized by IHW, which is Integrated Health and Wellbeing Council, and ISAR, which is Indian Society for Assisted Reproduction. Now, before we set the ball rolling, I request all of you to please have a look at the screen. We would like to showcase to you the video on IHW.
ये तो महत्वपूर्ण विषय है ही, पर उसके पहले हमको हॉस्पिटल या डॉक्टर के
diseases become barriers to growth. Weaving dreams of a world without sickness and full of well-being, the Integrated Health and Well-being Council was born. At its core, the council stands for the high five of health. Good air, good food, good water, good living, and good health care for everyone. Aligned with the United Nations Sustainable Development Goals, the Council firmly works towards making sure health reaches every corner of the world. IHW Council has built prestigious forums for holistic health discourse, like India Health and Wellness Summit and Awards, CSR Health Impact Awards, CME Excellence Movement, Ayushman Bharat Conclave, Jal Shakti Conclave, Digital Health Summit, Patient First Summit, the Good Air Movement and Summit, Rapid Global Cancer Alliance, and the She Alliance for Spirituality in Health and the Environment. These initiatives have received wholehearted support from policymakers, industry captains, community leaders, health experts, celebrities, and influencers. Respected brands and advocates have also joined the Council, becoming allies in the mission for a healthier world.
I think this wellness is an important initiative. I will definitely be interested to know the conclusions of your deliberations, and I'll definitely take these issues and your suggestions forward to the logical conclusion.
हेल्थ सर्विसेज कैसी होनी चाहिए, ये तो महत्वपूर्ण विषय है ही, पर उसके पहले हमको हॉस्पिटल या डॉक्टर के पास जाने की जरूरत न पड़े, इसके लिए हमारे एयर पोल्यूशन और वाटर पोल्यूशन को हम कैसे सुधारें, इस बात पर जोर देने की आवश्यकता है।
कहते हैं क्षिति जल पावक गगन समीरा, पंच तत्व निर्मित यह अधम शरीरा। ये पंच तत्वों से निर्मित यह शरीर पुनः पंच तत्व में ही मिल जाता है, तो हमें उन पंच तत्व का, जिससे इस शरीर की रचना हुई है, आकाश, पृथ्वी, अग्नि, वायु, जल, इन सबका ख्याल ही नहीं रखना, बल्कि इन पंच तत्वों का रक्षा करना हमारा पहला कर्तव्य हो जाता है।
In the digital world, the Council reaches millions with credible source of knowledge, empowering them to protect their health and prevent diseases. Through its various initiatives harnessing the power of social media, the Council impacts over 100 million lives annually. Join IHW Council in creating a world where limitless potential knows no bounds. Together, we can achieve a happier, healthier world for all.
Wow, that's amazing to see the incredible work done by the Council in the field of health. So, ladies and gentlemen, now I would like to once again welcome all of you to the IVF Summit. The IHW Council launched this summit in 2020, a year when the COVID-19 pandemic dominated the healthcare system, leaving thousands of couples seeking fertility treatments stranded. In collaboration with BSV and ISAR, we hosted India's first virtual IVF Summit on World IVF Day 2020. This event is aimed to advocate for uninterrupted fertility care for childless couples and to create a policy framework for equitable, compassionate, and affordable IVF art interventions. The summit has now become an annual event on World IVF Day with continued support and participation from ISAR. I also want to highlight that the IHW Council, which is India's premier institution for health awareness and advocacy, has initiated many landmark initiatives in partnership with institutions like FOXY to enhance and improve women's health in India. Before we begin, I would like to acknowledge our esteemed co-host, ISAR, which is Indian Society for Assisted Reproduction. ISAR has been a leading force in the industry, and their commitment to excellence aligns perfectly with the values we celebrate today. We are also grateful for the support of our partners. Their support has been instrumental in bringing this event to life. I would like to acknowledge our partners, Bharat Serums Private Limited, Fibe, Cooper Surgical, Imprimis IVF, Samarth Life Sciences, Evagenic, our legal partner, Trust Legal, our communication partner, Teamwork Communications, our digital partner, IHW TV. Ladies and gentlemen, I am totally honored to be your today's event's MC, and we as a team are thrilled to have you all join us for this landmark occasion where we recognize and celebrate this exceptional contributions to the field of IVF in India. So now let's watch a video that highlights the success story of IVF. Please have a look at the screen now.
Infertility, a worldwide problem affecting 50 to 80 million couples. Childlessness, a growing health concern. Stressful lifestyles, malnourishment, poor menstrual health, societal and emotional issues, sexual health and women health seen as taboo and stigma. Couples are hesitant to talk about the problem. India is home to 28 million couples with fertility issues. Infertility is a growing health concern for Indian couples. Infertility has become a personal public health issue in India. During COVID-19, the inability to access medical care further aggravated the situation for millions of couples. Understanding the seriousness, IHW Council, the leading health well-being advocacy institution in India, realized the need of creating a strong one-to-one networking platform. Since COVID-19 crisis, we are bringing the entire IVF sector together. For the last 4 years, IHW Council is bringing policymakers, regulatory authority, government and private organizations, medical professionals, sexual health experts, infertility clinics, together to discuss the best solutions and way forward, bringing more than 500 experts from the entire ecosystems of IVF to discuss the critical issues and find comprehensive solutions. The 5th edition will focus on in-depth information on the complete ART procedure, precautions and awareness, infrastructure and insurance challenges, building awareness on the entire process of IVF to bring new hope and resilience for all the couples. Welcome to the 5th IVF Summit and Awards.
What a fascinating video, having a positive impact on the society. Also, ladies and gentlemen, I assure you that this summit promises to be an incredible opportunity for all of you to learn, grow, and network. Now we will begin with the inauguration ceremony, and I'm delighted to invite on stage the man for all the seasons, Mr. Kamal Narayan, CEO of IHW Council, to deliver the opening remarks. Let's give a thunderous round of applause and let's welcome him on the stage, everyone.
morning, everyone. And thank you, Kamal, for inviting another Kamal. The World IVF Day, almost 46 years after the world saw the miracle of science in form of the first test tube baby getting born and seeing the light of the day. Those 46 years have seen a great progress when it comes to ART services, treatments that help millions of childless couples across the world. These couples are facing multiple challenges. This is not just the state of not having a child, but this leads to multiple traumatic experiences, whether it is family pressures, stress, psychological issues, social factors, and lot many more. IVF as a intervention has helped millions of people so far getting out of these traumatic situations, these traumatic circumstances. We at IHW Council have been focusing on all those aspects which make we human live better, live healthier, and achieve our life's potential. And when it comes to achieving our life's potential, along with many other physical and mental health related issues, infertility definitely comes as among one major and more critical aspect, because that many times lead to a variety and a host of other problems. At IHW Council, when we talk about good air, good food, good water, good living, good health care for all, we also look into the various aspects which these factors either contribute to or affect adversely. Air, water, food, everything is, while impacting our various health aspects, including NCDs, cardiovascular problems, cancer, diabetes, and many others, it is also contributing a lot, and the studies have shown to the fertility or the fertility health of the people. And that's where, when we are talking about the whole systemic change of improvising the health of the people from good air, food, water, living, and health care, we also need to look into a lot of those important scientific ways to address these problems, those medical advancements, and IVF as one of the stream definitely stands very tall over there. This led us to start talking about the various challenges, the opportunities which the industry or the whole medical fraternity dedicated towards the fertility care of the people was facing, especially at the time of COVID-19, as we heard and saw in the video also. And 2020 was the year when, because of many circumstances built because of the COVID-19 problem, people could not have access to the IVF or many other health-related, general health-related services also. And that led us to bring together the entire fraternity of ART experts, IVF experts, to work in the area of IVF and look at those challenges, draw the attention of the government and the society, so that we can ensure a seamless uninterrupted support for the people who need it. Today, when we are standing and celebrating the World IVF Day and also becoming a part of the 5th landmark IVF Summit, I welcome all of you for being here despite a relatively difficult day today. It has been raining since morning. Many of our guest speakers are still on the way and we expect them to be arriving over the day. So thank you so much all of you for being here, and we look forward to the day full of learnings, discussions, understanding how we can look at ensuring the innovative, more compassionate, more emphatic, and more equitable ways to ensure that all those who have not been able to have the blessings of parenthood, we from the medical fraternity can help them achieve that, which can lead to a healthier, happier life and a better ways to achieve their life's potential in all sense of which can be helpful. Thank you so much.
Thank you, sir, for setting the context for the proceedings ahead in the most relevant way. We now have a special video message from Dr. Amit Patki, President of ASAR, who will share his insights and thoughts with all of us. Please glue your eyes to the screen, everyone.
Hi friends, this is Amit Patki, your President at ASAR. I bring you greetings from ASAR and its 6,000 members based in India and neighboring countries. Today, the 25th of July, we celebrate as World IVF Day. It is a day that the world's first test tube baby, Louis John Brown, was born. And I think that was a path-breaking invention, innovation to alleviate the sorrows of millions of couples who couldn't conceive and have their own baby. In the last 47 years, fertility specialists have toiled day and night to ensure that couples get the joy of having the baby. And today we celebrate World IVF Day to acknowledge such organizations, individuals who have excelled in their work. I think it's very important that we identify those organizations and individuals who are increasing awareness of infertility and offering infertility treatments and options in every corner of India. So join me as we join hands with the Integrated Health and Well-being, popularly known as IHW, to celebrate this World IVF Day in Delhi. Unfortunately, because of prior commitments, I'm unable to be with you today physically, but I'm there with you in spirit, and I assure you that it will be a grand event, a great summit, and a great awards night later on. So thank you for joining, and I wish to congratulate all the awardees who have excelled in their work, and I'm sure we will meet every year to acknowledge, recognize such organizations and individuals who have worked towards the fertility treatment in India. Thank you very much.
Well, did you notice something? We saw the picture of Sir with the world's first IVF baby, named Louis Brown, the very reason why we celebrate this day. Thank you, Dr. Patki, for this inspiring message. As we move forward, let's set the stage for our inaugural session, the 5th India IVF Summit and Awards, which is a celebration of the remarkable advancements and contributions within the IVF industry. It is our privilege to honor the trailblazers who are shaping the future of fertility treatments. Our first major session today is titled India's Infertility Crisis, Advancing Equitable and Compassionate Fertility Care. This session will delve into the growing challenges of infertility in India and explore the urgent need for effective public health strategies. We will discuss the multifaceted issues surrounding assisted reproductive technologies and examine emerging policy frameworks aimed at improving accessibility and addressing legal and ethical considerations. Joining us for this crucial discussions are Mr. Abhishek Agarwal, Chief Business Officer of Birla Fertility and IVF. He is the Chief Business Officer of Birla Fertility and IVF and a board member of CK Birla Healthcare Private Limited, part of the $2.9 billion CK Birla Group. He was part of the founding team that launched Birla Fertility and IVF in 2020, driving its growth strategy, business plans, partnerships, and brand development to achieve global recognition in healthcare. Since joining the CK Birla Group in 2014, he has been pivotal in launching CK Birla Healthcare Private Limited, overseeing growth strategy, projects, sales, brand, and marketing. I request you, sir, to please come on the stage and occupy the distinguished chair. Our next panelist is Dr. Shivani Sachdev Kaur, founder and director of SCI Healthcare. She is founder and director of SCI Healthcare. SCI IVF is a state-of-the-art fertility center located in New Delhi. Dr. Shivani completed her graduation and specialty training in gynecology and obstetrics from Mumbai. She worked and trained in IVF for 4 years in the UK at Hammersmith Hospital, London, and the Royal Infirmary of Edinburgh, Scotland. Thank you, ma'am, for being here with us. Next, we have Dr. Rohan Palshetkar. I request you, sir, to please come on the stage. And now, let's welcome on stage our moderator for the session, Mr. Kamal Narayan, CEO of IHW Council. Please, let's give a huge round of applause for all of them. And let's begin.
So good morning again, and it's a privilege to have such a illustrious panel with us, and also having Dr. Rohan, who has come from all the way from Mumbai and is also among the emerging lights when it comes to IVF, and also bringing that whole support and intervention for the couples who are looking at this medical marvel as one silver lining for them to get that blissful parenthood. Mr. Abhishek, Dr. Shivani Sachdev Kaur, we have a unique perspective in a way to dwell into how the industry. I have also some reservation calling it as industry, because that has also led to a lot of misconceptions and perceptions about this medical practice. So having said that, having somebody who is providing and ensuring that IVF services reaches to not only the metros of our country but also goes to those the interiors, semi-metro, semi-urban areas as well, in form of Birla IVF and also Dr. Shivani Sachdevgaur, who has been an eminent and expert in this space. So let me begin with Dr. Shivani. Dr. Shivani, when it comes to infertility, so let's look at the broader challenge which our country is facing, and also how much do we realize that it is becoming an emergency to tackle? How do you see the infertility rate growing? What are the key factors as a clinicians you find that is contributing to that? And what should be the way forward if we want to address this problem of infertility, which is leading to multiple other challenges, whether it's social and family discourse and multiple emotional, mental health. So all that comes with or stem out of from this problem. How do you look at as a clinician, as an expert, this problem, and how do you see the solutions?
Kamalji, thank you very much for inviting to this wonderful program today. And I'm sure you have seen the latest report published by the World Health Organization, which was in 2023, where initially it was estimated that 1 in 10 couples, maybe 10 years ago, and now 2023, WHO has published that it is 1 in 6 couples who are now experiencing infertility. And they did a very good thing this time. They looked at high income countries, middle income and low income countries. So they wanted to compare and see if it is, because in India you think of population as a problem, like you don't excessive. So they looked at high in middle and low income countries, and they found that the percentage of infertility was uniform. It is not like any income is affecting the percentage of population causing infertility. The second thing that they also addressed was what are the main causes, as you mentioned, which have led us to this problem today. And what it was found was in our country like India, child marriages, a positive thing for us, is becoming less common than what it was 10 years ago. Women are now getting married at a later age, and in fact at the other extreme, many are postponing childbearing. There have been some positive steps towards addressing this by a lot of the major industries like you have Facebook, Google, Deloitte. So many big industries have said that we will support our employees for fertility treatment, also for egg freezing, so that to level the playing field between men and women, so that career does not push them back in fertility point of view. So one of the main reasons why this incidence has increased is age of the woman. As you realize, the most critical factor when we get down to basics and ABC of fertility, it is nothing other than age, which none of us can go back into. So it is the age of the woman which is the crux of the factor. Second, 10 years ago, the availability of fertility services was minuscule as compared to what it is today. I'm seeing Rohan agreeing with me very strongly. So it has penetrated into the heart of the country. And now we have fertility services available, so people who previously had no access and financial constraints are getting more aware and taking access of it. Then we have lifestyle disorders which have exploded and have affected every field of medicine, like late night awakenings and unhealthy lifestyle leading to PCOD, endometriosis, and lifestyle disorders. These have affected fertility even for men with alcohol, smoking consumption, lack of sleep, and one of the most important factors is lack of awareness. People are seeing celebrities and actresses every day in the media saying that we are having 3 babies at the age of 40 and 42. So people think fertility is endless, and they are not going to, if they maintain a healthy lifestyle, they will not face any problem. But unfortunately, we all have a biological clock, and the need of the hour is education to make women realize that 35 years is your cutoff, and after that you will definitely face fertility issues irrespective of the being followers of Bollywood celebrities. Then I think you also mentioned that how do we address this issue. So the most important thing is awareness, like what we are doing today. Information is powerful. Only when our patients are aware about these factors will they be able to take any steps to make sure that they don't fall into this. And as you very rightly pointed out, today we are celebrating incredible journeys of these couples who have gone through one of the toughest challenges. Having a child is so natural for so many people, and when you face something so difficult with something so natural, you need to be so tough, and it has to be a celebration today of their journeys, because you get emotional guilt, you feel socially isolated, you don't attend family functions wherever you go. This is the question which is asked everywhere, that is depression, anxiety, young couples facing financial strain because there is no insurance or anything to cover this. So, thank you.
No, I think very important points, Dr. Gaur, when you highlighted that how the rate of infertility is increasing. You have also highlighted and mentioned about how we are missing those biological clocks, not because we prefer to do that, but the modern lifestyle, the modern need for career building and all that leads to those kind of choices. You also mentioned that there was a time when fertility services were not much available, and Rohan also endorsed that. This is the time when fertility services are quite visible. We can see even on a back of an auto these days. I'm coming to Mr. Abhishek. So when it comes to, there is a big load of infertility, which is growing very fast. And all these factors, lifestyle choices, career choices, and a lot of environmental factors also are contributing to it. So definitely there is a massive need of this health intervention, which is so far being considered as a service. He talked about celebrities having triplets at the age of 40, 45, and so on and so forth. There was a time when IVF seemed to be an absolute luxury and only associated with celebrities. I was a journalist, and if Dr. Gaur may remember, I interviewed her when she came back from UK. And at that time also, IVF was all about Farah Khan, this Khan, that Khan only. So this has built a very strong perception that IVF is only meant for rich people, only meant for those who do not want to have babies at certain time, or they do not want to have baby themselves, and where this whole surrogacy discussion comes in. Abhishek, when you are trying to build a chain of clinics, which is coming from a brand people trust, for that matter, what is the dynamics you are facing in terms of the perception from the government towards IVF, the perception from the people, and also at a time where in certain cases and pockets, IVF is being oversupplied.
Thank you, Kamal, for inviting us, and a very good morning to everyone here. I think from our perspective and the question you asked, Kamal, it's a very interesting question. From the perspective of the patient and the couple who is actually looking for the treatment, actually the problems are threefold. Some of it Dr. Shivani has covered. I think to simplify, it is basically availability and access closer to their homes. Now gone are those days, I think all of India, and if you even think about what really India is, India actually lives in Bharat. And by Bharat, I mean the tier 2 and tier 3 towns of India. Everybody for any healthcare issue was forced to travel to the big towns, the big 5-7 towns of India. It still happens, but the expectation of our population has changed, and they want the treatment and reliable and quality treatment closer to their homes. Have we solved that problem? Not yet. One of our missions is to solve that. I think slowly the IVF provider sector is getting deeper and deeper into the towns and cities of Bharat. And that's the direction that we are headed to. It's the right direction, I believe. The second perspective of the patient is, can I afford this treatment? And affordability is a big concern, and it's only about 10 to 15% of Indian population where the household income is more than ₹1 lakh a month. About 40% of India actually earns between 30,000 rupees a month to ₹1 lakh. Now, on an average IVF treatment in India, we all know, costs about 1.5 to 2 lakh rupees per cycle. And that too, the average number of cycles a patient might need to go through would be anywhere between 1.5 to 2, right? On an average would be 1.5, let's say, given the success rates. Yeah, so, and not to mention, before the patient actually reaches to the decision-making point that I do need to undergo IVF treatment, they would have gone through tons of consultations, examinations, and would be depleted financially, emotionally as well. So the cost of treatment is actually undiscovered and hidden. It is a lot more than the cost of an IVF cycle. So its affordability is a big question. As providers, we need to solve it by bringing in the right pricing there. As policy makers, what we need to do in India is to consider this issue. Yes, we are a high population country, but we are, there is no more the phase where India had the demographic dividend. We are below a TFR of 2, which we all know. India will age in 30 years of time, and the time to intervene is now. So from a policy maker side, making sure that both access and affordability for our patients get solved, and from the provider segment, action on the direction of this policy support has to follow through. Now, what do I mean by policy interventions? It is time to consider that IVF is a health issue, infertility is a health issue, and getting it covered under the ambit of insurance will help these couples. Otherwise, it remains just, I think, marquee corporates in India taking care of their employees. So it doesn't get to the masses unless it's covered under the health insurance policies. Second is the government or the policymakers also, I understand we have bigger problems to fight. There is sexual health, there is maternal health and neonatal health, which are occupying bigger mind space for policy governance in India. But if not tackled now, this will be a large matter in 2 decades sitting on our hands as a country. And it takes time to shift this, so that will be a second intervention. The third problem, so we've spoken about access, affordability, Dr. Shivani touched upon it, is as well as awareness. From patient perspective, the time they could take to realize what is the right intervention for them, and IVF is not the only solution for infertility. There are many precursor steps. IVF is always the last resort. But the time taken to travel, given the social and cultural pressures of not discussing this problem with anybody, not seeking help, and in that process losing 4 to 5 golden years of the time when it could have been solved without an IVF goes by. And that's where government can help. I think we have seen polio program being a big success in the country. It could not have been achieved without the government picking up the mandate and saying, we will eradicate this, and it is eradicated today. Something of that sort, and normalizing the conversation around IVF requires this partnership from the public sector as well as the operators.
Right. So, Abhishek, a stitch in time saves 9. That's where, we have to head to, because if we are not looking at infertility as a big health issue now, this is going to create a more complicated problem maybe 2 decades from now. Dr. Rohan, so as you know, I tried to create a contrast that where do we need fertility services or IVF or many other ART procedures or support for almost 30 million couples now in India. The number may keep growing, and at the same time the forming perception, the gaps in the whole space, whether in terms of affordability, whether in terms of quality, whether in terms of trust, and also in terms of ethics. Ethical questions are also big question when it comes to the whole IVF space. When you look at it, and since you are a relatively a newcomer in this space, and I'm sure you must be practicing for a few years, but there is a whole new pathway lying in front of you, which is full of challenges, which is full of opportunities. Opportunities are that we have a big market, we are going to have a big number of people struggling with fertility issues. Many of them would require, many of them can definitely be helped with many other ways, and not ultimately IVF, but a lot of them are going to look for or need IVF, and not only in cities but also in villages where players like CK Birla is going. And also I heard that Bloom IVF is now you're traveling from Mumbai to Muzaffarnagar. Yes. To take care of the center over there, and then in Kanpur and many other those places. How do you see this way forward, where we need a more empathetic insurance coverage? We need the government to look into this as a public health issue and look for a certain support system, maybe Ayushman Bharat or a state government supports. And also, at the same time, the government also try to bring those regulations which sometime always may not be in the best interest of the industry. How do you see that problem to be tackled in the future, so that the ultimate goal of ensuring, equitable fertility care reaching to everyone who need it.
Absolutely. I think these are some wonderful points that you brought up. I've been in practice for over 10 years now. And when I saw my practice back in 2015, and when I look at it today, there's been quite a stark contrast. When you're talking about equitable, when we're looking, as you say, that the number of patients that are increasing in the fertility sector are increasing. Dr. Shivani talked about the fertility rate going from 10% to almost 17.5%. Mr. Abhishek also was talking about how we need to be able to expand into the smaller cities. Now when we go to look at it, now I'll give you an example from us. We've gone into Muzaffarnagar, which is quite an interior city in UP. We look at a much further market. When we're looking at expanding, the biggest problem, as you said, is cost. So what's happening now is there are facilities which are making it possible for the entire market, as you're saying, to access this treatment protocol. There are certain companies which are providing insurances for the patients to be able to cover it. There are financing plans also which are there, which are covering the costs for these patients as well. When we look at the government as well, I think the government is doing a fabulous job in terms of trying to get the Ayushman Bharat also to become a part of the infertility treatment. I think in Madhya Pradesh, they've already established the Ayushman Bharat for infertility services. And I think as we go on expanding, as we go on improving this, there are going to be changes which is going to make this treatment accessible to all. I think when I look back in 1978 was when we talk about the international Louise Brown who was born. A lot of people don't understand that 3 months later, Durga, who was India's first IVF baby, was born from India, the first in Asia when we're talking about. We're just talking about this. So when we look at then we're looking at Dr. Indira Hinduja, and when in 1998 actually started booming, the number of patients that have access has improved immensely. As you said, there were 30 lakh couples we are talking about delivering or accessing fertility treatments. If you look at 1990s, there mustn't have even been about 1 to 2 lakh patients at that point who had the access to it. So we are looking at an increased access. Then we have everyone who's trying to expand into the market, who is trying to make sure that accessibility is there to the tier 2 as well as tier 3 cities. See, setting up an IVF lab is a little bit of an income intense as well as labor intense process. But being able to set up satellite labs now with teleconsultations, online consultations, majority of these things can be done remotely where they just need to come in. When I look at the laws of India, especially the ART Act which has come in as well as the Surrogacy Act, I look at it as a positive thing. I agree that yes, some of them, they seem restrictive, but they are for patient benefit. And I also see that when we look at the government of India, they are constant. See, this is a new act. No law is ever going to be perfect when it's implemented at the start. But as the law is being amended day by day, we are seeing improvements in order to benefit the patients as well as the doctors. As you said that there was a different perception of ethics when we looked at IVF, saying that surrogacy is being done by doctors for everyone. In fact, the government has made it easier and made it a black and white process for us where it's very clear that the couples need to get a court order to do surrogacy. See, the whole point of being able to perform the surrogacy procedure was to give those parents who weren't able to conceive themselves for achieving parenthood. And that's actually helping out. The ART law, as you said, you also mentioned, Kamal, about triplets which were there. We've been talking about shifting over to singleton pregnancies for the last 10 years. The government of India's law has made us self-regulate the fact that the chances of triplets are going to reduce. So these laws are being extremely helpful, not only for the service providers, but also for the patients as well. See, it's not that of course, we want to be able to give everyone babies, but that doesn't mean that we go beyond a certain point about the ethics and consideration. again, with the laws of India which are being placed, I think they're streamlining the entire process. They're helping us out to be able to be beneficial for patients as well as being able to self-regulate. So in a way, these laws which have come in, I don't think are being a hindrance, and especially to the younger generation who is getting in. I see my juniors who are entering, they are coming better trained. They are any IVF specialist who wants to enter needs certain qualifications. Now, not everyone can become. So the patient safety, the patient education, as well as the doctor's ability to be an expert in the field is going to improve. Kamal, 1978 success rate of IVF was 5% to 6%. We're talking about almost a 40 to 50% success rate in 2024. These laws, these regulations are going to help us develop the technology and possibly increase these success rates even further. I always, my mother always says, she's an IVF specialist herself, Dr. Nandita Palchetkar. She always says, Rohan, we've gone through the trials and tribulations till today. You all have got the cream of the work. I say, I absolutely agree. But at the same time, when I look at it today about, say, 10 years into practice, she's been in practice for almost 35 years. When I look at 10 years into practice, I say that you all did all the hard work, but now we are making sure that your technology goes further. Right. We're using artificial intelligence, we're using so many technologies that are there in order to improve success rates as well as make it accessible to couples to get pregnant as well.
I loved your zeal about all the positive possibilities which lie ahead your area of work, and especially this important intervention, important support, and a very, very critical need of all those who want to experience that most natural aspect of life, is Dr. Shivani said, parenthood. With the paucity of time, and also I am cognizant of the fact that you need to travel back to Mumbai and Dr. Shivani need to take care of some Muhurat delivery. They are twins, I think. Huh? Great. So we should not, kind of come on the way of this. So let me just conclude this particular session. We talked about the challenges, but at the same time we talked about what all is going to help these childless couples, these service providers, these medical experts who are now working and are more aligned to what should be done in terms of the practice, in terms of the ethics. And I'm sure that as you said that the law keep evolving and we look for the more self-regulation, we are going to do far better in that. This has been a tremendous journey, as you mentioned. IVF definitely is much more accessible for people now when it comes to affordability, with the advent of technology, with the involvement of multiple other aspects, including your telemedicine and many other things. A lot of collateral expenses are going to get reduced. And also, as the governments are now, with the efforts of all the people who are passionate about this cause, is waking up, coming up with more compassionate approaches. It is going to be all, in the benefit of those who really need this as a help and as a medical support. So thank you so much, our speakers, for joining us today. And we have a day full of conversations and experts joining us, discussing the multiple aspects. We also have a very interesting session lined up immediately after it, which is to bring into that the entire light on the legal framework around the IVF as an industry, or the new surrogacy law or ART Act. We look forward to that, an engaging day and the great evening. Thank you so much, all of you.
Thank you.
Thank you to all the panelists and our moderator, sir. Well, I hope that was thought-provoking. And now we move on to the next one, ladies and gentlemen. But I request all of you to please come back because we have the felicitation. So I request Mr. Kamal Narayan to kindly come back on the stage. And may I request first Mr. Abhishek Agarwal to kindly come back on the stage to receive the award. We would like to acknowledge your presence, your participation in the panel discussion. So I request Mr. Abhishek Agarwal to kindly find the way to the stage. Ladies and gentlemen, can we please give a huge round of applause for each one of them, for their participation, for sharing their expertise with all of us. I request Dr. Shivani Sachdev to kindly come on the stage. Thank you, sir. Ladies and gentlemen, one hand against the other, please keep applauding. Next, I request Dr. Rohan Palshetkar to please come on the stage. We would also like to acknowledge him as emerging leader in IVF. Ladies and gentlemen, can we give a big hand for him, everyone? Dr. Rohan, I request you to please stay back and receive the award on behalf of your mother, Dr. Nandita Palshetkar, who is an exemplary leader, and she's getting the Leadership Award in Fertility Care in IVF. Thank you so much. We request Advocate Sudhir Mishra, Partner Trust Legal, to please come on the stage, who is also our partner. Come on, ladies and gentlemen, can we increase the decibel level of the room? I request someone from Cooper Surgical to kindly come on the stage. I request you, sir, to please stay back. We have one more representative from Cooper Surgical getting the award for MedTech Excellence in Fertility. I request you to please come on the stage. All right. So, we will do that later. We're expecting someone from this. Now, ladies and gentlemen, we are pleased to present a spotlight session by Mr. Sudhir Mishra, an eminent healthcare lawyer. His talk will address the possibility and the challenges in surrogacy and ART in the light of evolving laws in India. This session will offer valuable insights into the evolving legislative landscape surrounding surrogacy and assisted reproductive technologies. Following this, we will also have a tea break, ladies and gentlemen, so please stay tuned.
Good morning. So works. We have a very thin audience for the time being, but I can tell you we will have a very interesting conversation. The journey of my firm for last 15 years primarily we worked in healthcare sector. And when I say we worked in the healthcare sector, every major chain which came into India in the field of IVF, we were instrumental in guiding them on their Indian strategy when there were no laws, there were no legal provision, the sector was unregulated, and understanding of IVF was even more complex. Today, if you ask me, the first observation which I'll make it, that the whole IVF landscape has been given a sanctity, a halo, if I put it, a dignity, because there is a law in place in 2021, which has been made applicable in 2022 with the passing of the rules. So first you make a law, then you implement it on the ground, 2022. And as we advised all the leading chains, we were part of the parliamentary discussion process of the surrogacy bill, as well as all the debates which were happening, that what all we should keep. As lawyers, one of the duties which we have is to always point out to the regulator or the people who are creating the law that, look, you can make these mistakes. So we were trying to tell the government, and somebody like Sushma Swaraj was personally not being in charge of the health ministry. She was inviting as the member of parliament comments about the entire healthcare bill in 2013, 14, 15, 16. And in those debates, my partner, who is also in the audience, Patel Chandok, she used to go and participate and contribute. Now what happened actually? The law was passed hurriedly and implemented in a manner as if there is an emergency. To an extent it was needed, because what was happening, if any sector becomes too unregulated, malpractices of various kinds happen, and those malpractices I'm not going to mention here, this is not the forum, but you know, this sector got the attention of the government like never before, and the prime reason was that so many issues were landing up before the government with regard to granting of visa to the abandoned children. Children were left unattended, or they were not properly, their health was an issue, somebody abandoned them. So a lot of such malpractices happened, and then the courts started approaching to these things, and then the government in the reverse started thinking of regulating the sector. But when you started regulating the sector, your rules were half-baked. You didn't go into the details of the rules making. And then the courts came in picture. So I would say, more than the government, more than the regulator, Justice Nagaratna has done more service by entertaining dozens of petitions which redefined how this law will be implemented on the ground. And she still sees with the matter. So what all she did? In 2023, the first petition she allowed the standard deviation, fundamental deviation. So you had a rule which is just 1 year old, the law which is just 1 year old, and Justice Nagaratna ensured, and because she is the future Chief Justice of this country, first women Chief Justice of this country, she's bold. So she took the decision and she said, look, donors will be allowed. First deviation. And now she is dictating how this law will be decided, how this law will be evolved. But she was very conscious of the responsibility. So you know how it happens in this country. And I say it, and Kamal is a very dear friend. He knows that my journey with IVF is very deep, personally also. So I'm not somebody who is like makes money out of it. I have advised all the leading chains. I don't want to take names of virtually everybody. But I know it very deeply from all aspects. I have seen it from 360 degree, from close, and experienced it, and have been a beneficiary. But I tell you one very important thing. Your country was not in a dock. All those stories of womb on rent was not the reason. The reason was the commercial compulsions of other countries which were dictating terms. They were competing with you. They were doing those kind of surrogate advertising, and you were at the receiving end. You were not organized, and you got a law which was half-baked. You didn't do enough policy, enough mehnat the way pharma companies do. Am I right or wrong? The way in COVID, when we were given the injection, see the kind of work which happened within months. We failed to do it. I tried to unite the entire sector. Kamal tried to unite the entire sector. We failed, actually. Now what is happening is a silver lining. Another chance you have, and that's the reason why I'm here. I'm only going to tell you nuggets what's happening. Supreme Court is still seized with the matter. So now you have a new drafting committee, which is sitting. So our Supreme Court makes law, and they have the same force like a normal law. Our High Courts makes law, they have the same force like a normal law. That's the meaning of law in this country. So Supreme Court said donors will be allowed, तो donor allowed हो गए. For Supreme Court में कोई और भी गया, उन्होंने बोला single women will have a child. Supreme Court said no. And she indicated, she didn't give a final finding. She said, look, you are 44-year-old, you have to get married. She said, but if I get married and next month I take a divorce, then I'm eligible. This is not a great logic. She said, no. United Nations says, SDG, Social Development Goals say, and she quoted fundamental duties, she quoted directive principle of state policy, that family as institution is important. So since family as institution is important, if you have not got married, still you want to have a baby, we will not be party to that. She has already indicated. So she took one stand where either of the parent is suffering from any particular issue, then the eggs or sperm can be donated. She allowed. Government notified the law in 2024 accordingly, because how it happens, court gives you a judgment, government sometimes resists those judgments. When they see that this complete tsunami of such judgments are coming, like 24 people went after that. All of them were allowed. You get one judgment, all of them will be allowed. So the court, after the courts, the government came up with their own modifications. So 2024 February, those modifications have come in place now. More modifications are on way. More judgments are on way. But I don't see, except for one or two people, really pushing it the way pharmaceutical companies really work on the policy and the entire thing. And I'm not saying anything controversial. I'm just saying, please work on your advocacy and policy more, because we have already lost so much. So when I'm saying each and every multinational which has spent millions in this country on IVF, I was telling them, look, this is short-sighted approach. Please think about the insurance. Before the government thinks about the insurance, you start thinking about the insurance. Ultimately, they put all those things in the factor, and now you're factoring in. So my idea is that still go and follow what Supreme Court is doing. Supreme Court is now dealing with this issue that whether same-sex marriages, in fact, that is not allowed. So same-sex couple will be allowed. It is still pending. Similarly, same kind of people will be allowed. So there are various such petitions which are pending before Supreme Court. How much you are following them? So one of the things which I'm asking Kamal to do is, after this conference, and since he has kindly agreed to make us a partner in this, and we took out time, I will urge each and every doctor who is such a responsible work they are doing, and if they really want a far-reaching impact, like what is happening in diabetes, what is happening in cancer, then they should think about a policy and advocacy point of view, not merely a commercial transaction. So we can do a white paper for you. What is the position today, as of now? How many judgments have been passed in this particular matter? How many interventions are pending? What is the policy direction happening? What all government is going to tweak further? Government is actually struggling because there are so many contradictions. My partner was just telling me that one, they are saying you can't have a commercial transaction. At the same time, you are not supposed to know the person. यहाँ तो रिश्तेदार कोई आपका काम करने को तैयार नहीं कर, उसमें commercial transaction नहीं है, और आप expect करते हो commercial transaction नहीं होगा. So their contradictions are huge. There are many contradictions. But you know what is the silver lining in all of this? The silver lining is you have got a structure. Ask me how many representations have been made to budget to give them a status of industry or a halo, so that they are recognized in some kind of legal framework. IVF has been recognized in some kind of legal framework after almost 15, 20 years of their existence in India. So are we really taking full advantage of it? I don't think they are taking. What you're doing is you're working in a reactionary manner. Most of the IVF chains are working in a reactionary manner. पहले वो नेशनल बोर्ड को जाता था, अब डिस्ट्रिक्ट बोर्ड को जा रहा है. Everything we are trying to just be reactionary. I will say make your own position strong. You create your own systems, and if your systems are strong enough, the courts will agree, the government will agree, and the laws will be changed. Thank you. Thanks a lot. I can answer questions if you have any. Yeah. So since you have an act in place now, and there is a system called appropriate authority. So the best example is, and this is very easy, no litigation, nothing has to be done. You have to compile where all it has been created and how successful that process is and how it has made life simple for people who are availing the services of the district boards or the state board or whatever authority has been created. Make a representation. That representation they will sleep over. Nobody will react. Take that representation to a high court and say, but because the first question the high court will ask, have you gone to the government and told them that why you are not creating it in your state? So you'll say, yes sir, I did it 1 month back, 2 months back, 2 बार चिट्ठी लिखा, नहीं हुआ. अब आपके शरण में आए, first date notice will be issued. And within 3 dates to 4 dates it can be created. And I'm saying it because apart from environment, I worry for the air pollution and other issues, so I file writ petitions all the time. This is the easiest way of doing, no court fee, nothing. Writ petition is your right. All these people who have gone to the Supreme Court or who are getting addressal, it's not costing them a lot because there is no court fee involved in it. You just have to file in the petition in the Supreme Court. You're filing intervention after intervention, you're getting a relief immediately. So our judicial process is very effective. And I would say this is what we do in every sector. So if some state does very well on GST, or a particular health facility is given, or labor laws are simplified for clinics, or diagnostic related some new judgments have come where you unnecessarily harass the radiologist or the doctors who are into it, we get those judgments and use it in the state where it has to be used. So that is what our job is, to use the experiences of the good states and take it to the states which are lagging behind.
That the surrogate mother did not be related, but the sentence is in such a way that there should be genetic relation to the child. That means one of the gametes should be from the couple or both the gametes. Our lawyer on the board is interpreting as that it is genetic related, means the surrogate mother is genetically related to the couple.
No.
And it is, we had to fight. I mean, at least our appropriate authority has listened to us, but in many districts in Gujarat, he is still writing that she has to be genetically related to the couple.
Same system we'll do. We'll go under 226 in the High Court of Gujarat and say this is what the interpretation, because this question was also before the Supreme Court. Because the act was little confusing there, that you should have a distance but you should be related. So there it is very clear that the child has to be genetically related to the parents. That's the only thing. But they can be blood related with the surrogate. But that's a different aspect altogether. So a lot of people are making those mistakes. So we'll have to file a writ petition, get an order. That's the easiest thing to do.
And about couples with one child, even if it's normal.
So they have gone to the Supreme Court. Supreme Court is listening to that petition. Again, I'm saying, that's why I'm saying this petition, and thanks to you, Kamal, I educated myself on all these latest aspects. And I was debating with my partner and she said, sir, this is such an important petition. Like, when you worry about the air and water of this country, MC Mehta versus Union of India was the mothership. When you talk about the liberty of yours, whether you can travel anywhere unrestricted, Menaka Gandhi versus Union of India was the matter. When she was stopped from going abroad at the peak of Congress power. Similarly, this petition, which was started in 2022, is that kind of petition, but unfortunately it is not getting the attention which the IVF stakeholders should give it to.
Also the age bar. If the female is just
Yes.
50 complete and the husband is 52 or the female is 41.
It can be challenged. Because now since you have challenged the basic DNA, the fountainhead was the donor issue. It was a big issue. That you needed to have your own eggs and sperm, that part has gone, which was the biggest stumbling block. If you have a case where the age can be relaxed, you can again go to the court and ask for that relaxation. Now the good part is, if you go to the Supreme Court directly, they say, no, don't come under us. under Article 32 because it has to have 2 or 3 states involved. But since there is a IVF petition pending before the Supreme Court, you have a right to file intervention there. And you will get a faster remedy. Age relaxation भी होगा अगर आप establish कर सके कि ये बहुत fit case है कि यहाँ पर हमको relax करना चाहिए. It won't be done in a generic manner.
It will not be done as a blanket thing.
No, no. Because you know what? How it is interpreted. The court's job is not to set aside completely an entire act. Court's job is not there. Court's job is to see that the provisions of a particular act is not causing a harm which is beyond the aspects and the duties of that act. Even your constitution, which is ordinarily supposed to be the most sacred document, you take oath on it, has gone through so many amendments on the same procedure. Or the courts have allowed certain things under that. It's the most important document. Even that has gone through amendment. You can't set aside the constitution. तो मैं उसको हटाऊंगा नहीं और आराम से उसमें से if I can show an exception because that has been debated in the parliament. All of you have been asked to come and give your point of view. My partner had given her point of view because the people who are practicing in this area, and you had ample chance. And finally it was in the public notice. Then they have come up with this. Now some exceptional circumstances are there that can be deviated.
Thank you.
Yes, sir. Okay, so thank you. Thanks a lot for this opportunity. Thank you, Kamal. Thanks a lot.
Thank you, sir, for explaining it in the most lucid terms laymen can understand. Thank you for sharing your knowledge and expertise of this field, especially the legal matters. Thank you so much, sir, for being here with us. It feels so amazing to be amongst the most accomplished individuals who are present with us today. So, ladies and gentlemen, now we would like to take a short break. Please don't forget to mingle around and please help yourself to the refreshments at the designated area outside the hall. Thank you. So we're taking a break for 15 minutes. Please kindly be back and we will start with our first panel discussion.
experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people, introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people, introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people, introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people, introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all,
resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How boring. India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate.
I request
The one
all
who
of you to
nurtures
kindly
the
come
dream
back
of
and be seated.
a world
We're waiting for everyone
that
to settle
ensures
down
good
first
health
so that
for
we
all.
can kickstart again.
resolves to change the way health information is seen and perceived by people.
Everyone who's standing outside,
Introducing
please come back.
How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank candid
Well,
conversations.
it's a very good idea to
for
get
a
your tea and
happier,
coffee inside. I can see
healthier
a
you.
couple of you having it here inside.
Exclusively
So
on
please do that
IHW Council's
and be
YouTube.
comfortable. You can also stretch yourself a little bit. You have been getting fidgety from long time. I'm sure the tea break was a great refreshment and it was quite energizing.
India's foremost holistic health advocate.
Also, ladies and gentlemen,
The one who
I
nurtures
hope you
the
know
dream
that I've
of
already announced it. We have
a world
placed 2 QR
that
codes on the
ensures good
table.
health for
One
all.
is to access your
resolves to change
e-certificate
the
of
way health
participation,
information
and
is
the
seen
another
and
one
perceived
is
by
to
people.
access the agenda of the event,
Introducing
to stay up to date of what is
How
coming
Boring,
next.
India's first holistic
So please
well-being podcast.
do scan it and download your e-participation certificate as well.
No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations.
All right,
for
ladies
a
and
happier,
gentlemen, please be
healthier
seated.
you.
We are starting now.
Exclusively on
Please, everyone,
IHW
be
Council's
seated.
YouTube.
Kindly settle down now. You can stretch yourself a little bit as well. Please be comfortable in doing that. Please give me heads up if you're ready to begin. Give me the heads up. I've just got one. Ready, everyone? All right. So, ladies and gentlemen, welcome back. Our next session is panel discussion. The first panel discussion focusing on innovations and breakthroughs in IVF. The discussion will explore the latest technologies in fertility treatments, including fintech innovations and their impact on IVF procedures. We will also address the affordability of modern treatments and the role of favorable insurance structures. And we are truly privileged to have a distinguished panel of experts with us today. Each of our panelists brings a wealth of experience and a unique perspective that will undoubtedly enrich the discussion. So please welcome on stage Dr. Abha Majumdar, Director of IVF Department at Sir Gangaram Hospital. She is the alumna of Sarojini Naidu Medical College, Agra, and recipient of multiple academic honors, established IVF technology at Sir Gangaram Hospital, New Delhi, delivering the first IVF baby there in 1991, leading one of India's largest IVF centers. She pioneers ethical infertility treatments, manages high-risk pregnancies, and performs fertility-enhancing surgeries. Known for her innovative approaches, she notably prolonged the intrauterine life of a twin for 104 days as the first clinician in North India to run an NBE-recognized postdoctoral fellowship in reproductive medicine. She is committed to sharing her expertise and advancing human reproduction. Please, ladies and gentlemen, let's give a huge round of applause for her. Our next panelist is Dr. K.D. Nair, Chief Consultant in Fertility at Akanksha IVF Center. I request you, sir, to please come on the stage. He's a renowned IVF specialist and infertility expert with extensive experience and efficiency in his field. He has received prestigious training abroad and is the recipient of numerous national and international awards. Dr. Nair leads Delhi's largest and most experienced team comprising 4 clinical consultants, 4 embryologists, a counselor, and andrologists, and 18 skilled staff members, all dedicated to achieving exceptional results. Next we have Mr. Sakti Prasad Menon, Executive Vice President, BNPL 5. I request you to please come on the stage. And ladies and gentlemen, now please welcome our moderator for the session, Dr. Reema Sarkar. Let's give a huge round of applause once again for all of them. I request you, ma'am, to please take over.
Hello, good afternoon, everyone. So I welcome you to this panel of innovations and breakthrough in IVF. I think we've left out one of our esteemed panelists, Dr. Gunjan. She's here. Yeah, she's the director of Gunjan IVF, and she practices in and around NCR. Welcome, Dr. Gunjan. right in your face. So I'm very happy that I have a dream panel, a very illustrious panelist on this interaction today, and I'm looking forward to getting real, good, useful points from this panel. Starting from you, Abha ma'am, can you you have been practicing, I know, I was just a beginner or maybe a little girl only. Since then I've been watching you, ma'am, and we've read your books and we've always heard your lectures. So I think you would be the best person who can shed some light on the evolution of innovations in the IVF sector in India. Like, how have you seen it evolve?
Okay, I'll need 2 minutes to talk about this. Innovations have happened in many scores. One is medicines, 2 is equipment, 3 is technology, and 4 is making it more safe and friendly for patients. When we talk about innovation in drugs, the first IVF baby was produced by an oral ovulation induction drug, clomiphene citrate. We have come a long way from that. We are using gonadotropins, which are extremely comfortable. They are injected by pens to patients so that patient can do it themselves. And right now we still have a daily injection. Very soon we would be coming to maybe once a week injection. So this is where we have innovated in drugs and many more things in drugs. This is one basic thing. Number 2, in the equipment. I still remember the days when we started IVF. My embryologist was Dr. Raj Kaur, a retired PhD clinician of Dr. Talwar those days. She used to make media in-house. We used to have triple distilled water, and media was created in-house. Yes, we did have CO2 incubators, and that is how we started our IVF. Today, we have the best medias available. We have one media to grow our embryos for all 5-6 days. There are incubators now where we don't even have to take out the embryos or change the media, and we can still monitor the growth of embryo on a daily basis. So this is as far as the laboratory equipment has changed. I mean, I'm giving you very, very simple examples. Then in technology, we started with IVF, where we just put the sperm and egg together. We came up to ICSI, that is intracytoplasmic sperm injection, where very few sperms could reach the egg also. Normally when we do IVF, we need at least 50 to 100,000 sperms per egg. Here we needed 1 to 2 sperm per egg just to pick up the right egg. Then came in laser hatching, then came in egg freezing, embryo freezing, and then the third party reproduction also started down the line, donor eggs. Then we also started hiring the mother's womb with the patient's own eggs and her husband's own sperm, her own genetic child being brought up in another womb. And then as far as technology is going, we've got so much going. AI is coming in, genetic encrypting has started. We can take biopsies, the invasive, non-invasive ones, look at the genetic makeup of an embryo and only implant it if it is normal. We can even eliminate genetic diseases from couples who are suffering from, generations together with a genetic disease. And that can be identified on genetic testing of an embryo, move out those embryos and only implant the healthy ones. So we have moved a very, very long way. Patient friendly, yes. Now, the biggest thing is we can go on to one embryo transfer so that the risk of multiple pregnancy goes. Our pregnancy rates have gone up to those benchmarks where one embryo transfer could give us a 50% pregnancy rate and still a 35% live birth rate. So I would say it's become very easy for patients. The risk of multiple pregnancy, the whole corollary of complications which happens with that can be avoided. And medicines, we just give one vaginal tablet in a fresh transfer and one oral, one vaginal tablet in a frozen transfer. Frozen transfer also we are doing in natural cycles where we give no medicines, maybe one vaginal progesterone, that is all. So this is as far as patient convenience goes.
Absolutely perfect, ma'am. You've taken me down the memory lane, so much of nostalgia. Yes, correct. I remember the days when we used to run, when as juniors, our seniors would tell us to go look at the PN, Raat mein, and then third day embryo, and then, fifth day embryo, fourth day embryo, everything we used to watch. And of course, yes, the ease, Pele, we used to be so scared for everything. Now, because it was a newer technology for us, and now that experience has been added, yes, we are much more confident of our steps. So,
recently I was there at ASHRAE, and the very interesting study which was presented was, because we are talking always about injections in IVF, which is a huge concern, 10 days, 15. So it is, there was this study in which they would manage just 3. Of course, Dr. Abha just shortly said that FSH would be reduced, the stimulation to 1, and the NTAG also he used 1. And just a trigger. So it was 3 injection IVF, and results were actually comparable to our routine stimulation protocols. So that is where innovations are going further. So I'm sure we all have a long way to go still. Thanks.
we are still waiting for that day, like
Yeah,
really
he,
for
no,
that.
he has
that
already done the studies there,
No,
the
in
German
India.
study. Yeah.
In India.
Once a day is a very old protocol of giving antagonist, but somehow the whole world did not take it. We took the daily antagonist protocol because it was more manageable. But once a day exists since
No, once a
1990s.
week. For 5 days, just one, the long
Yes,
acting.
that is 3 milligrams of antag,
Yeah.
which is given just once when you want to give, and it works for about 4 days.
Yeah.
But if your stimulation goes longer, you would have to add. So that is there. Yes, it is one of the differences. We use the German, this is the French, I think, or vice versa. So one of the countries is very stuck on that once a day antagonist, either France or Germany. And the whole world has taken the multiple dose.
Great. So I'll take it forward with Dr. Nair, sir. Sir, can you start by giving us an overview of the latest technological advancements in IVF treatment that have emerged in India in recent years? You can, just enumerate a few, and I would like you or request you to please talk about your favorite one that you feel has really been very helpful in your point of view.
The one technology which we have adopted in our lab since few years is the time lapse. Time lapse is giving us a big advantage in monitoring the embryo and helping the embryologist to select the best embryo. And with these days, along with the artificial intelligence coming into play, you can very well decide the best embryo using the various various paradigms they have come out with artificial intelligence. You can select the best embryo, and you can know that this patient is going to get pregnancy or not. That is the advantage. So that time-lapse monitoring is the one thing which has really revolutionized, and we have been practicing it in our everyday lab work. That has helped. Other thing is the assisted laser hatching which has come, which also we are using since last maybe 8 years. We have got laser hatching, and once before embryo transfer, we put this laser to the embryo zona and then to the embryo transfer. It results in a better pregnancy rate. That is one thing which has come. Dr. Ava has already mentioned about ICSI, and going beyond ICSI, IMSI has also come. Although we are not using their report that IMSI doesn't add much to the pregnancy rate, so that is why this technology has not caught up in a big way. But this was there, and besides this, the cryopreservation techniques have improved tremendously. From slow freezing, we have gone to vitrification, to even single sperm vitrification, and the vitrification process has helped us in going for frozen gametes, frozen embryo transfer, and that has really helped. Now, these are the few technologies which we have been using in our lab, and it has made a lot of difference. It has made a difference to us as a clinician, to my embryologist, to the patient also. They are much happy.
Right, sir. So we've come a very long way. I agree with you, sir. Now that you've just mentioned vitrification, the other day in a conference only, I was seeing cryopreservation of embryos is a big headache for any any IVF clinic is really a headache I won't use, is a very big responsibility. So I was seeing this fully automated cryopreservations that have come up. Mainly, I saw it with a Chinese lab. I'm not sure if others are also using it.
Automated cryopreservation also requires an embryologist. So we cannot do away with the embryologist. You at least have to reach that stage where you have to vitrify it. So this is not working. Automated cryopreservation is a very attractive thing, and we thought we'll do away with the embryologists. We won't need them. But we would still need them, because to reach them to that automated machine, we need an embryologist to bring the embryo there.
Absolutely, ma'am. There is no way that the clinician and embryologist will always have their role, no matter what. However, with the manual, error that can be cut off with all the lawsuits and everything, the precision that can be brought up with these things, they will definitely help us. They can't replace us, but they are definitely very, very helpful. Dr. Gunjan, I'll come to you for now. AI, everyone has been talking so much about it, and we've all incorporated it in our practices in some way or the other. How do you feel? How much of AI are you depending in your lab? How much of it? And do you think it's helpful?
See, AI in itself is always increases the precision. You know, what is artificial intelligence all about? It is like we have multiple brains who are helping us to take a decision. That is all if I talk about AI, whether it is writing, whether it is our labs, anywhere. So AI is there to help us, and it is there to stay. So in my lab, the maximum utilization of AI, I would say, is in when you can upload, choosing when you have multiple embryos. AI really helps in selection, and it is pretty easy. We have these techniques in which you upload the photo, and within seconds you get an answer for that. And that helps in choosing us, reaching to better decisions, which to freeze, which to transfer. It saves us from the trouble of doing multiple embryos transfer, because previously there was an era in which the embryos being transferred in more numbers, and now we all have gone low, 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 and the lowest to 1 is what our target is. So AI there is definitely helping us a long way in choosing the best embryo, and going forward it will also help us in choosing the right egg, the best sperms. So there are these technologies which are coming in sperm selection as well, which are helping when choose the sperm. So naturally all this will help us, assist us in improving the results, our overall success rate, and that is where everything is dependent on. So this is my thing.
Of course, even Sir talked about embryo labs and,
embryoscope, of course,
time lapse and
time-lapse imaging has helped. So I think now we are going even beyond time-lapse imaging. Time-lapse, of course, it helped us, and it was the biggest advantage was we were not taking out the embryo in and out of the incubator. We were just observing. So naturally it was helping. But now things are other way also. But time-lapse imaging, despite it being very, very good and results, evidence is limited in its favor. That was the only thing. And of course, if we consider the India scenario, also comes as the cost, which we have to understand. If somebody is having multiple labs, how many labs can you have time-lapse imaging? So that is where a practice. So now we have an easier option as well, which we can use, which we are using it. What we do is we upload the images of the blasts, and within hardly 10 seconds or less than a minute, I can say the report comes, and we have the report that this is the gradation. If you have got 6 embryos, they will just grade it from all the 6 embryos as to how to go about, and that works beautifully. That works beautifully. Actually, end of the day, embryologist can do the same thing, isn't it? He can just go check, answer, do. So it's just we are reducing his work, or you can say we are validating his work is what the AI is doing. So that way.
Agreed. So in the end, I think it is all about best sperm selection. It is all about best oocyte selection. It is about best ICSI, how it is performed, and to be able to give
robo ICSI also, which was
that is what I'm coming now.
Robo ICSI as well, which is there.
Yes. So, and in the end, giving a perfectly healthy, let's say, a single embryo transfer to the couple. And exactly what Dr. Gunjan has brought about, other than the cost issues, I was just browsing through the net, and I came across this website called Conceivable Life Sciences. They were talking about fully automated labs in which everything from selection of the sperm to the selection of the oocyte and even the ICSI procedures, everything from start to the end will be performed just with the push of a button. So we are talking, the world is looking at fully automated labs, and of course, while the aim is not to replace anyone, but then the logic behind is that there is so much that can be achieved manually. We do have this restrictive factor where people or when the job is done by, it is done manually, so we get to achieve maybe more in same amount of time with the machines and with more precision. Let's say, the chance of error, they say, is cut down, and in the long run, other than the setup cost, in the long run, maybe the cost of IVF can also be brought down considerably with these automated labs. That's the thing of the not very far away in future, but still it's not here to stay. So, Mr. Menon, I'll come to you now. We've been talking about all these innovations and breakthroughs and making best available to our patients, let's say. India, especially this scenario, nothing is state-sponsored. The health is not, everything, every penny patient is bringing out of their own pocket. Thankfully, after the act, some of the companies have come up with insurance policies. But how do you see the fintech, or the financial technology that has come in handy in bringing these innovations actually to the end user?
Oh, thank you. So yeah, from the word itself, handy, on a lighter note, when I was walking in, the organizers handed me a card which called me a doctor by mistake. So I said, already, that's the thought. We don't want to be an outsider when it comes to the thought of bringing affordability. It should be hand in hand. If a person can buy a home, or if a person walks into any store to buy a mobile phone, there is so much of ease. But today what happens is that a probable parent want to go through a lot of other set of psychological things which they want to plan, especially when it goes to not from the tier 1 markets, when it goes to the actual Bharat of the India. People have a lot of stigma associated with it. In that case, why do you even have to give another set of trauma for that person to go avail a loan and facility? That's not what we want. We want to, and the technology should be in a way that the lending company should work very close with the service providers to give that facility. So in an irony, when I'm in an esteemed group like this, it is very clear that how we want to shake that hands. Now, when it comes to technology company today, what happens is that like before in the previous panel also, Mr. Abhishek was mentioning very interesting point. The IVF in the last 5 years or the last 10 years has moved from a celebrity concept to a normal person's concept. But still, the largest gap that is there is that to convince a person, one, to start with the procedure, and the most important part, like we've been interacting with a lot of people, is that they are very much worried about the success of what would happen, and alongside with the stigma. So one of the key innovations that we are trying to bring into the market, working along with the insurance companies, because like you rightly mentioned, though with few acts, certain people or certain companies are providing this facility. But again, these are the companies which are providing this to the salaried customer. Salaried customers today already can afford this otherwise also, but we should be actually helping the people who are in the real Bharat, the cities outside the 7 metro cities, where the knowledge of one, IVF is low, and second also how the affordability is working is also low. To help those people, we are working along with few insurance companies and also with the service providers, that how fast, without a set of documents, or it doesn't look like he's applying for a home loan, it should be a very seamless process with few data points he or she can provide. We'll be able to help the consultant who is at the counter to pitch to the probable parent that you don't have to take care of the worry of finding the resources. The resources would be provided by us, working along with the lending company, and this is a very large phenomenon back in the US market. In US markets, all the service providers work hand in hand with lending companies. They provide the solution upfront. So when the parents walk in, the probable parents walk in, they give a sheet which says that, hey, we cover your 3 cycles. Of the 3 cycles, if the probability of the first is X, Y, and Z for the first, all the 3 cycles, they'll help you and give you a quotation with respect to that along with the finance providers. So that's what we are trying to create in the market, and I think with working collaboratively with a lot of partners like in this group, we'll be able to provide a lot of value to the system and make it more than making it affordable. What we would call it as making it more democratic, so that it doesn't belong to the elite class. It becomes more of a mass thing, and we eradicate the taboo or the thought behind this.
Very well said, Mr. Menon. For those who don't know, he works with a BNPL company, buy now, pay later, right? So this is the concept that is coming into, he's rightly pointed out that it is more common in the West, in the US, and it is where at the time of checkout, the customer is probably given the option of paying later while they can take this instant credit. That is the difference between taking a loan and this instant credit facility. However, I would like to you to also, point out a few factors that the end user should keep in mind while they are, going in for this BNPL facility. For example, what is it that they're going for? I think they should know.
Sure. See, one of the largest stigma around taking any loan in this country is that we've been taught from our childhood that you should not be lending out from someone. But here what we're trying to say is that this is not a loan, or this is not something which you're providing as a credit. It's more like you're supporting because you're going through a lot of process at that point of time. We don't want to have an additional burden to that particular person. So that's the add-on that we are trying to give to that person. Secondly, we should also work with the regulators to find out the ways where how insurance can also be mapped along with it, because we also finance a lot of health insurance premiums. So we are the largest health insurance premium financiers in the country. So health insurance, today we work with a lot of health insurance also to provide that coverage, which is still a very debatable topic that is happening in the country, but we really want to walk that path.
I have a question. It is like book now, pay later. Yeah. So the patient books with you, goes through IVF cycle, you've paid for it, it fails. What now? The patient just says, I will not pay. How do you get your payment back? Because it's failed once, it may fail twice also. How many times will you go on supporting and the patient says, okay, I'll pay, and he doesn't get pregnant within a cycle or 2. How do you recover your money?
I mean, a great point, ma'am. That's exactly where we want to work together. Like I mentioned in the previous point, in other countries, what we have learned and trying to implement is that rather than giving an opportunity for a person or a couple to do it for the first cycle, we holistically create a report working with the technology saying that there are 5-6 parameters. I'm not an expert to tell the parameters, but the parameters would come from the IVF companies, which says that the probability of this couple conceiving in the cycle 1, cycle 2, cycle 3, and cycle 4. So combined, we will be giving a view to them saying that this couple might need a probable chance on the cycle 2, or this couple would have a cycle 3 versus cycle 1. With respect to that, we kind of underwrite a risk, because this is my job or our company's job to ensure that we mitigate that risk, but at the same time being empathetical towards them and not banging their doors to collect the money.
I'm very happy, Abha ma'am, that you've brought this question. I was going to take it up later, but now that you've brought it up. So again, while browsing, I came across this something called protection plans, and there's this silver line family. So what these people are doing, they are offering the couple they have tied up with a few centers, of course, where, now the couple is asked to pay around 40 to 50% of the package. The deal is that they have to take a 2 or 3 cycle package, and they have tied up with the clinics who are who do have very high success rates. So 50, let's say it is 2 lakh, the package cost. So the couple is asked to pay 1 lakh or 70,000 to begin with. And in case it fails, let's say it fails, all 3 cycles in the package have failed. So while they had enrolled this couple, they take a loan from a bank on this couple's behalf, and if it fails, then you are waived off. This entire loan is waived off. So this 2 lakh, the couple doesn't have to pay. In a way, it helps the couple because now they were able to take a 3-cycle package with 70,000 to 1 lakh. And the company, of course, it makes from whatever it makes. And in case, however, it succeeds, in case the couple does conceive, then they will pay around, that the 2 lakh and that 70,000, so they end up paying, let's say 1.5 times of what they were supposed to pay.
So, Rima, this was a concept in a lot of IVF centers maybe 15 years ago. They used to say package for 3 cycles, but otherwise your cycle would cost say 1.5 or 2 maybe each cycle. We'll just give you a package of 3 cycles for 2 lakhs. And all those patients who conceived in the first cycle, they were out. So you already got a 50,000 extra money from everyone. And then you could take up the second and third cycle. So this was a concept there in our country. And we used to see a lot of ads, 3 cycles package, where we'll cost you, instead of 1.5 lakh a cycle, will only cost you 2 lakh for all 3 cycles. And it was done.
Yes, of course, we'll have to find, yes,
was also
a lot of people. I came across some IVF Suraksha plan also that some hospital was giving, wherein they were also giving. But I, again, don't know, ma'am, how much legally correct would that be? Because, it kind of gives an assurance of the treatment. So, there will be a lot of aspects, ethical, legal, that we'll have to explore.
It could not sustain.
So, but it was a good concept, the usual Jugadu Funda of Indians. Let's do it, if not this way, that way.
Dr. Rima, you see, there are few IVF centers which has given even money back. Also.
Yes, money back.
Yes.
Again,
that also came.
But that
for
is
some
not ethically correct.
That's
It
what
is
we
all
are
commercial,
discussing. This
very,
is
very
what we're
commercial.
discussing.
But
What the bank is waiving off now after a failure. So the concept is the same, but it has been given a nice outlook. That was happening in Gujarat, I think.
I'd like to make a point. One thing, there's no wave off which is involved.
Yeah.
There's
No. Wave off means they.
Sorry. You're taking maybe the cost of 1.5 cycle, and if the patient conceives, he's paid more than he would have paid in one cycle, but that would compensate for those who go for a second cycle or third cycle. And then I think they make a lot of concessions on injections and all. They give them maybe low-cost injections. I've seen a lot of irregularities happening in the name of second and third cycle.
Correct.
Thanks, Dr. Abha. I'll just like to make a point. We talk a lot about cost in IVF, but really I'd like to ask the house, is the cost that much? This is something I know. I feel, Dr. Abha, you are like the pillar of IVF, you and Dr. Nair, so it's my privilege that I have a chance that I put it. I think you people are an institution in yourselves, so I think we should actually work on putting down things. IVF is no longer expensive. This is what I talk about these days कि क्या बात करते हैं आप एक बोटॉक्स ट्रीटमेंट करवा लेते हो ₹1,00,000 का 2,00,000 रुपए का and you get a baby. आपकी एक दिन की ICU care is more than $1,00,000 a day.
Gunjan, you're probably seeing that part of the sector for whom Botox, buying cars or going out, taking trips abroad is easy. If you look at that sector, for whom when we say the IVF cost is 1,10,000 plus the medicines for 50,000 and freezing separate, they get a shudder. So there is a class who would find it difficult. And when we talk of cost, we are only looking to bring IVF to that sector. The sector which comes to us, we tell them one laparoscopy for endometriosis will cost you 2 lakhs. And IVF, everything done will cost you 2 lakhs. What do you want to go in? You don't, endometriosis will not ensure you a baby in the first cycle, IVF will. So if there is like not very advanced endometriosis, we tell them go for IVF, at least it will also cure your endometriosis. So that way, for those for whom 2 lakh is a small amount, IVF is not expensive. But there are many for whom 2 lakhs is a very big amount. My own receptionist would not be able to pay for IVF. Salary is
I liked
actually
how
ma'am, that is
Abhishek put it in the first panel that
No, I
that's
think that is
how-
where this thing is useful, which Mr. Menon is doing. They bifurcate the cost, then they don't have to pay 2 lakhs upfront.
That is not
that
very
makes
easy.
that makes around 20,000. If they have a clean, of course, there's a lot of things which is a long way to go. But I think just
Book now,
staggering the
pay
payment
later has a
helps
lot of negative
Yes, it is
comments
lucrative
also.
and, you
I
know.
looked into your whole website and I saw that people did find a lot of obstacles. Maybe it will become better in the years to come. But then whenever a loan is taken, it is always a burden on the patient's head. And if they fail, it becomes an even greater burden. I've seen patients whose embryos are frozen with us. They get pregnant and they never pay up the yearly charges for the rest frozen embryos. They come walking in after 6 years and say, I want another IVF. I say, you don't have embryos frozen because we do only one embryo freezing per straw. And they said, no, we did have one, but we never paid for it. So I said, go look for it. We have now cans which have exceeded the limit where we can keep them.
Absolutely
But they
correct.
always find the embryos there. And then they pay up for all the years and then they get the embryo.
That's so
Correct,
true.
correct.
That's so true.
Absolutely
People
correct.
don't bother once they get a child about any payment, about any leftover embryos. And we sort of prick them psychology. We said, you've left your little babies in a freezer can
Yes.
for so many years. You've not even funded for them and we've still kept your
Kept.
embryo.
But that's a very practical situation that everyone I think is facing now, whoever is old, that ek aadha case every day we are seeing in the OPD where we have to argue and settle them down and show them our point of view. Correct, ma'am? So, Nayyar sir, while we are talking about these and we are saying that a lot of aspects, things may not be as hunky-dory as they seem. We really need to fine-tune them. So I would like to know from you what, if you could highlight what are the points that an end user should be looking at before taking an insurance policy. If you could enumerate a few
You
points.
see, before taking an insurance policy, the couple has to be counseled. That is very important. Unfortunately, in India, we are not putting much emphasis on counseling. If you look at countries like UK, once the patient walk into the IVF clinic, the first person he sees is the counselor. The couple goes to the counselor and he is given the absolutely correct perception of the problem, the correct treatment plan, and the correct chances of pregnancy, achieving a pregnancy. That is how the couple make up their mind and then they go forward. Similarly, in India, we are not that much bothered about counseling. We are only interested in getting a patient and starting the stimulation. But if you put the patient to counseling at the very beginning, patient perception changes about the whole treatment plan, and then similarly patient can go for insurance policy as available. Right now in India we don't have insurance companies doing insurance for IVF. Probably it will come up in future. Some companies are coming up. Like we mentioned, for 2 cycles, 3 cycles, there are different plans. You can have to have some waiting period before going for IVF. You must be insured for at least 2-3 years, then you go for IVF. So all this thing will take some time to materialize in India. We still are in that initial phase. We are thinking of insurance company coming in.
Abha ma'am, if
Can
you
I make a few comments
Please,
here?
ma'am.
You see, when a person like Mr. Sakti is there, what are your points you would see in a patient before you extend them a loan? You would look at the age of the patient and we would give all that to you. Age is less than 37 or less than 35 or more. What is her ovarian reserve? What is the reason for IVF? Does she have a gynecological problem like fibroids, adenomyosis, endometriosis? All this will lower her chance of getting pregnant. So like when I at my age ask for insurance, my premium goes up by lots.
Right.
But my son who asks for insurance, the premium is much lower. So The same is going to happen with IVF patients also. You will need to fill up a certain form to say what are her chances of getting pregnant, and this you will have to take from general data from all over the world and from our country maybe, to see what age the insurance should be minimum, at what age it should be more, what AMH, antral follicle count, ovarian reserve, whatever marker we use, that, plus what are other factors which can lower her chances of pregnancy. And the insurance will be charged according to it. And abhi baat ho rahi thi ki shaadi hote insure kara do. So that, you know, if 5 years down the line one doesn't get pregnant, your insurance works automatically.
But it's correct, ma'am, because,
we all insure ourselves. We don't know tomorrow I'm going to get a heart attack or a fracture, and we are paying our insurance for last 45 years. God willing, abhi tak aisa kuch hua nahi hai. Insurance companies have earned a lot on our personal medical insurance.
Exactly. So to add to your point, today the larger problem the insurance companies are facing is the uncertainty around it. So uncertainty is the reason why they really don't want to get into this water. Like you rightly said, in other countries, matured countries, this is already part of it because they have a correct system to record all these points that you've mentioned. Today in India, the only record that we have for any company is something called a CIBIL score. किसी को loan देने जा रहा है. But that is not what we required. So with the government pushing in with the health card and the health score, we expect that in next, if not in next 2 years, maybe in 5 years
Today,
time.
10 companies have gone into insuring a donor.
Yeah.
So such a big step has been taken that all donors are insured, and on a small amount, that if anything happens to them within a year of egg pickup, the insurance will cover the cost. I think it's very easy for you all to take over insurance for real patients also. Think that they are donors.
I think they have come up, ma'am. A few companies have come up. And just to summarize this point, I think a few points. So for patients, policies right as of today are available in market as 2 forms, as an add-on into a previously existing health policy or as a standalone IVF policy that you can take. So one should check first of all what all is included, because some of them are only giving partial coverages where either medicines are not included or tests are not included. So it is important to see what all is covered, what is the waiting period. And some of them will ask for a minimum insured amount also. Then only will they help you out. And they're not instant, yes.
Yeah, there's always a waiting time to that. I was also going through them. So most of them have a waiting time of around 2 years, and partial coverage from 50,000 to 1 lakh is mostly what most of the companies. But for IVF,
For
yeah.
IVF.
For IVF, they've come up, and even actually here I like to make a point that big corporates like Tata and all, they have come forward. Like I have a patient who works in Barclays. She has undergone 3 IVF failures currently into her pregnancy and everything, and her everything was paid up. Like she came to us with 1 failure that she went through long thing. So every time we'd think her claim would be rejected, but it never was. So I think the corporates also have a huge role to play, because if the corporates combine with the insurance company, they have a lot more power, and IVF is just like any other medical condition, it should be considered. And if this, then it's the same game of numbers, because if they cover IVF for everybody, then they will get money from all of them and with no extra cost. And very few will require.
So yes, Dr. Gunjan has brought me to my next point that I was going to put forward, the corporate insurances. So since we are just reaching the time limit, so I'll just summarize it that companies, corporates like Microsoft and all, they have tied up in US, for example, there is this Carrot Fertility and Maven Fertility. There are other firms like that, wherein these all these corporates have all their employees insured with them. Or anywhere in the world, they help these thing out. Maybe in India, it's time we should also be looking at that.
Tata has started doing it.
Yeah, some of them have started.
This is what I said. Barclays is a multinational, but Tata is an Indian.
So with this, I think we come to the end of this panel. Just a concluding remark from each one of you, and we'll wind up. Ma'am.
Okay, my concluding remark is that we as clinicians and scientists, as embryologists, have to continue to do their work and grow, however AI we may have, because all the data which AI has is from the data we all have collected over time. And it is only to help the average embryologist and average clinician. If you want to do better than AI, then we all have to continue to strive for better clinical results and better embryological results.
Yes, ma'am.
I think our government has to come, the insurance sector will come forward with the insurance scheme for IVF. That is mandatory. That is what is being done abroad, and we should also have the insurance company helping the patient with the IVF process. That is must.
Right, sir. Thank you, sir. Need of the hour.
So for me, the closing remarks would be more like more of a responsibility that I have to walk out of this room to work together with this fraternity to ensure that we make it more democratic, not just from an insurance perspective, but also making the probable parent not feel like they're availing a loan, but they're going to have a baby. So that's what I think we all have to work together for.
Correct. Dr. Gunjan?
Yeah, in the end, I'd like to say this, IVF I always feel is a miraculous and an enigmatic journey. So there is lot of scope of lot of innovations, research, and as a healthcare industry in India where we have so many patients, I think we should work more on innovation and research and publication and ethics. That is will take this industry long further again.
Great. Like I said, lots of useful tips coming on from our panel of experts. With this, I'd like to wind up and say thank you for your patient hearing. Thank you so much.
Thank you, ma'am, for moderating the session smoothly, and thank you to all the panelists for sharing your valuable insights and your reflective knowledge. And now I request Mr. Kamal Narayan to please come on the stage to felicitate all our panelists and our moderator.
An excellent session.
Please, sir. Ladies and gentlemen, let's give a huge round of applause for Dr. Abha Majumdar. Please put your hands together for Dr. K.D. Nair. Please give a big hand for Mr. Sakti Prasad Menon. Another round of applause for Dr. Gunjan Gupta. And a big hand for Dr. Reema Sirkar. A group picture also. As they say, a picture is worth 1,000 words. And let's pose for a nice group picture. Also a testament to a wonderful session we had. I'm sure it was a learning session for all of us. Enjoyed every bit of it, and now let's enjoy the lunch, ladies and gentlemen. We are breaking for lunch for another 30 minutes. Then please come back and we have next panel discussion. Thank you.
India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors, and health experts in never-before frank candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank candid conversations for a happier, Healthier You. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. featuring India's top doctors and health experts in never-before frank candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information is seen and perceived by people. Introducing How Boring, India's first holistic well-being podcast with Kamal Narayan. No confusing medical jargons, just real talks. Featuring India's top doctors and health experts in never-before frank, candid conversations for a happier, healthier you. Exclusively on IHW Council's YouTube. India's foremost holistic health advocate, the one who nurtures the dream of a world that ensures good health for all, resolves to change the way health information.
Welcome back, ladies and gentlemen. Once again, kindly grab your chairs, be seated. I can see a lot of vacant chairs right in front of the stage. So please, I request all of you to occupy that first. Are we ready? Shall we start? All right. So next up is the panel discussion second on the topic patient-centric approach in fertility treatments. This session will address the psychological aspects of infertility, the importance of counseling, and the need for data-driven regulation and infrastructure to support a patient-centric approach. And our distinguished panelists are, please welcome on stage Dr. B.K. Rana, CEO of Quality and Accreditation Institute, QAI. Dr. B.K. Rana is the CEO of Quality and Accreditation Institute and former director and CEO in charge of NABH, Quality Council of India. He is a former board member of the International Society for Quality in Healthcare and chairman of Accreditation Council of ISQA, board member of Asian Society for Quality in Healthcare, ASQA, and served as president of ASQA in 2011 and 12, founding member of the International Academy of Quality and Safety and Scientific Advisory Board, International Alliance. Sharma, founder and director, Origin Fertility and IVF. Please put your hands together, everyone. Let's welcome her on the stage. And now I would like to invite on stage our moderator, Dr. Rakesh Samal, Director and Embryologist, Imprimis IVF and Fertility Center. I request you, sir, to please take over.
Hello everyone. So as we will discuss regarding these days, infertility is rising and patient comes to you with a lot of emotional stress, mental stress, but how we approach them, how we need to counsel them, because a lot of patients coming with a lot of histories of infertility and all. So but how the holistic approach from our side as a center, as IVF center, so we need to be discussed these days, and how counseling is the important part of the IVF center, then how to put them in the treatment and all. So now we will start the discussion. So hello sir, hello ma'am. So madam, how do you see that if patient comes to you and she has patient-centric approach for the patient. So how do you see?
So the thing is, empathy बहुत important चीज़ है. We have to have empathy to our patients, We have to understand these patients are already suffering a lot. So the first thing that a patient sits in front of my table, I thank God. I thank God that patient ने मुझे इतना काबिल समझा कि मेरे पास आया. ये हमारा सौभाग्य है कि patient हमारे पास आया. आजकल इतने patients हैं, तो पहले तो ये feeling हमें लानी पड़ेगी. और पेशेंट का हिस्ट्री सुनना बहुत इम्पॉर्टेंट है. कहीं ना कहीं हम आजकल की भागदौड़ में गुम हो गए हैं. हम कई बार सिर्फ लिखते रह जाते हैं या हम कंप्यूटर पे डेटा एंट्री करते रह जाते हैं और हमारा पेशेंट से आई कांटेक्ट ही नहीं होता. हम पेशेंट की शक्ल तक भी कई बार नहीं पहचान पाते, विच इज़ आई थिंक रॉन्ग. हमें पेशेंट के साथ बॉडी लैंग्वेज, बॉडी टॉक, यू नो, आई टू आई कॉन्टैक्ट, दैट इज़ वेरी इंपॉर्टेंट. पेशेंट हैज़ टू हैव दैट ट्रस्ट इन यू. और हम जो वर्बली बोलते हैं उससे कहीं ज़्यादा हमारी बॉडी लैंग्वेज कन्वे करती है. सो आई थिंक दिस इज़ वेरी इंपॉर्टेंट दैट वी हैव टू फील देयर पेन.
Yeah, means when patient comes to you and after infertility of several years, like 2-3 years, secondary infertility, primary infertility. So, but how the patient, where is he working, and how their social status, and how they've gone through all couples, the mental stress. So mainly, we need to understand the mental stress, how they are going, and what is the exact cause of the infertility and all. So by their psychological aspect and physiological aspect, we need to check it out. Before to start the treatment, we should to give some period to means for the minerals like your food, how to eat some good food and all the things, because these days we know what lot of things are getting infertility causes. So we need to give some good process to means like how to drink water, how much drink water, how to eat food for the PCOS patient, for other kind of patient, right?
Yeah, dietary advice वो सब तो है ही. उसके अलावा एक और बहुत important advice, to decrease stress. To decrease stress by having faith in two people. One is in your doctor, another is in God.
Yeah.
So that is also stress management, anxiety management is very important part of particularly infertility treatment.
Yes, because patient comes, means we have seen wives are crying in front of doctor, and I need babies. How you take that, get the effort, please make me babies. That the emotional touch with patient and the doctor should be the always ideal. And then, yeah. So how do you think that counseling part is means important? Like in IVF, in every IVF, we have a counselor. So before to meet the doctor, counselor will take all the history and all. But how counseling part is important to make patient familiar, make patient comfortable. So patient should feel like I'm in right position, right place. So how you think?
So counseling, I would say, is almost 50% important, as important as your clinical outcome, especially in cases of IVF. I always tell my fellows who are working with me that what you are learning, I mean, apart from the medical knowledge, it is very important to know how do you counsel pre-IVF and how do you counsel post-IVF, that is failure, because the live birth rate is 40-50%. 50 to 60% of the time patient is going to come back with a failure, and that too after spending a huge amount of money. And that is the time where your counseling will actually help. So that counseling is very important. In fact, psychological counseling is also very important. Thankfully, the government has now made it mandatory to have a psychological counselor, and I think that's a wonderful, fantastic step from the government side, because sometimes in our busy practice, we may not fail, we may fail to connect with the patient. That way, an independent psychological counselor is a very, very important addition to any IVF practice, and it can save doctors a lot of trouble later on.
Do you like to insight or give some experience?
That's called collaboration. Thank you, offering hands to others to help. So thank you very much, and I think quite interesting. And coming from a different background, like you're running IVF centers, we provide accreditation to IVF centers. So coming from the background of standard development settings and conducting assessment on IVF centers and looking at how you are doing and compared to the standard set. And when we talk about patient-centric approach, so my approach would be a little different than, obviously one component which you mentioned is integral part of that. I'm not sure if everyone around the table is really aware of what patient-centric care means. In most of the time, while I have a discussion and interaction with people, patient-centric care means when you talk about patient and the disease the patient is suffering from, in your case, infertility. But actually, that's not the patient-centric care. Patient-centric care in true sense is when patient is in the center of care and the family around and the community around. So there's three layers: the patient, the family, and the community. That actually form the patient-centric care approach, which essentially means you don't talk about and only treat the disease or the diagnosis you made, but you listen to the patient, because every patient is different. All are human, that's the common element. Everyone is a human being. But other than that, it's all different. Patient may react differently to the same medication, same treatment, same protocol because of physiological differences, physical differences, mental differences. Many, many factors play important role in how an individual react to your treatment protocol. So we need to individualized care, not using the same protocol uniquely across all the people.
Tailor-cut treatment.
So you have to really think. It's very simple. An example like when you get a painkiller, it's not always Dolo 650 for everyone. It's actually said because it's for adult, which weight is 45 or 48 kg and above. But if you go to the pediatric dose, it's based on the base. How much weight the patient or the kid has,
The BMI.
and then you calculate. So it's not some same thing across. So it's extended to the same for the clinical protocol for infertility as well. So when patient is in the center, and there are, like you mentioned, a lot of emotional approaches to be really included in that. Counseling forms one of the integral part of taking care of the mental issues, mental health. People is suffering, and then this really comes in. So how you really read the patient and the understanding of the need of the specific patient, and then talk about the family. It's not just the patient, because many things comes from the family that as a integrated discussion and decision made. So it's not just patient particularly. And then obviously the community plays important role, and COVID times has taught us how community play important role. For individuals, when patients suffering of COVID, nobody come forward when the community comes forward to help you. So it's like, that's what the patient-centric care means. And I would elaborate more when we move forward with that. So that's my take on this
I
approach.
also
for that.
include,
Thank you.
add on some here because I am working at Kashmir. So their IVF, right now they understand the IVF. But the mindset, their cultural things, like they are not go for the donor, other than means after their AMH is so low, very much low, like 0.001, but they will come, Dr. Shah, please come, give me some PRP, but I would like to go for self-oocyte. But we know as an embryologist and the doctors means how quality of oocyte will compromise after AMH is 0.01 and all AMH is low. But patient go for same cycle, patient want to go for the self-treatment, self-cycle instead of donor. So we need to understand by their community, by their mental and their status and everything.
Yeah.
So
that's actually essentially says is we need to take care of individual beliefs, which may come from the own self, maybe cultural differences, maybe the religions related things. So that's called patient's beliefs, which we as a provider, healthcare provider, you need to really look at, as you gave the right example for that.
And so we should not be looking for the cycles. We need to understand the patient exact mental status and physiological status. Means by accordingly you can plan, accordingly you can treat them. As you know, if a patient comes to you, like after you get to know by history and all, the PCOD patient or AMH patient, something, what is the causes? So accordingly we need to plan, means how like you start the stimulation and all, but before to that, their hope, they should be feel hope that's if I am there, so I am in your right hand. So but how do you see, sir, means if private sector, what is the you feel the private sector and standalone center to see these days advancement and the quality of regulation?
So if I understand your question is how how a player is respective of government, private, small or bigger, how they are really making their journey towards providing good care, which every patient expect. When you say my success rate is ABC, and patient comes to you, how you really take care of that. Obviously, is very uncertain, and for that matter, I think medical field itself is uncertain. No doctor can give you a guarantee that yes, after this procedure you will be perfectly fine. And I think same goes with the IVF or even infertility, which comes into place. So, so I think it's to me, as I mentioned, that we can only say when we put standards in place, right? And it's not essentially that you need to go for accreditation. You just use the standards. And when we started in 2017, develop a standard for art centers for accreditation, there was no law, no art act. It was after that, right? But what we were saying is that it's like self-regulation. The standards for accreditation provides an opportunities for centers to self-regulate. And essentially, I can say that in many partners sitting here which are accredited by us, when they go for licensing under art act, they find it's very easy because everything is in place. They need not to really work extra to get the license under art act. They have everything in place. So irrespective of coming from the government or private, smaller or bigger, I think when there is an act in place, you are supposed to comply, essentially, not supposed, essentially comply with those minimum requirements prescribed in the act, right? So that's the bare minimum, like we say, to practice medicine, you have to have MBBS first. And similarly, to run an healthcare organization, you need to comply with Clinical Establishment Act requirement minimally. But over and above, you can do whatever you like. You can excel, you can advance, you can innovate, you can do whatever you like. And that's differentiate one clinic to the clinic, right? So what technology, what skill set your team has, and what are the necessary processes you put in place to give more confidence to your patient, more confidence to the community. So people have trust, okay, this is the center I need to go because they are this, you know. So that makes them different from the crowd. Though all of those are minimally meeting the art act requirements, which is essential to meet, but keeping you separate to demonstrate your credibility, your trust into the people is that you adopt standards which are extra over and above the minimum requirement for act. So I think that's how, but essentially I think India is too big country and it's not mandatory. Accreditation is not mandatory, it's a voluntary process. So voluntary process has its own route and take up, but essentially we see in the past most of the big players are already with us. Because when you set the processes, I would say documented processes, you minimize your risk tremendously. Because there are huge risks associated in any healthcare facility. It's a brand, it's your own corporate culture, even for the government. So the procedures help you, the records. When you do something, you don't write. You don't have records. So patient come back with a complaint that what you did with me. I say, we did this. You did correct. No harm, you did correct. But you don't have any evidence to say, to demonstrate you did this. If you had everything documented, you could say, this is what it is, we did it. So it's hugely reduce your risks. And then, obviously, when you reduce your risk, you are more comfort. So your comfort zone goes up. And then you make ways of providing clinical care to your patient more efficient, more effective manner with more confidence.
Yeah, means like in center, like now there should be one internal audit to be there and with external audit, like QIS.
Yes.
So your external audit, so the internal team, how they're working by the protocol and what are the treatment, what are the embryology are doing, and the technician, how is they're doing the sterility, they are maintaining or not, everything. So these internal audit and external audit can helpful for every IVF center to get reach their success rate and all to patient-centric, either patient-centric or patient success rate. Right. So what is the infrastructural improvement you need for the patient-centric approach?
Yeah, it's very difficult questions to answer. As I said, that Art Act, or for that matter, any act or regulation, actually make sure that you have minimal structural things in place. So if Art Act, you need a facility which has 2 rooms, 3 rooms of this size, you have a gynecologist with art expertise, you have andrologists, you have, embryologists, you have counselor, they have prescribed, these are structural requirements, right? So you have to have those structural requirements in place. But again, when you talk about more efficient care, more effective care, more safe care, more equitable care, more accessible care, and these are the component of quality of care as per WHO, then absolutely you need to put certain more impacts and efforts to build that organization. And then using that minimum structure, you need to develop processes. And these processes will help you in identifying what are your outcomes. So when you say your success rate is 60+%, what is the basis of saying that? That's the outcome. So in essentially what we drive through a standard is structures, process, and outcome. Yes. Whereas in the act, they're merely limited to the structure, little bit of processes, not like it's no processes, little bit of processes, obviously, but not for entirety in the organization. So basically, when you put the structures in place, and also, I think we need to keep in mind, what is the scope of services you are offering to your patient? All centers are not offering everything to patient. Somebody is simply doing IUI, simply IUI. So you don't need that infrastructure which you need for IVF, right? So it depends on the nature of clinical services you are offering to your patient. You need to have those structures in place, what you call infrastructure. We call it man-machine environment. I'm sorry, it's women-machine environment as well. It's not just man. So you have to have human resources, you have to have physical infrastructure, you have to equipment, and then over and above the financial resources. So these are called structures. And then processes, patient admission, patient identification, surgical intervention, process for that, even discharge process for that, whatever things. And then measure the outcomes for different things. So this is how, if you really use this process of building your organization, I'm sure you are going to be better and better day by day.
But these days, some centers are doing their holistic approach, like the yoga center, something they are coming with that. So to get patient calm and hormonal balance, mentally balanced, stress free, and to make them
yes,
stress free.
That's called integrated approach.
Yeah.
Holistic approach, or I call it integrated approach. When you see there is patient distance, so release the mental stress, how you calm down. And I think, you can correct me, madam, when you have mental stress, I think it influences your body changes, physiological changes, impact your processes. Yeah. So why not provide a therapy prior to that, which can calm down the patient, reduces that thing, and increases the chances of whatever you're expecting out of the patient. So I think that's holistic or integrated approach must be in place, depending on, it's not just like, I'll just give an example. Long back, more than maybe 10, 15 years back, going from office to home, home to office like this, and working in an environment. I was with NABL at that time, well before I was in NABH, NABL 1999, somewhere in 2000. And I feel like quite, and I went to a doctor, physician, and he got on my blood pressure. It was like, say, 100 by 160 or 180. And I said, wow, that's fantastic. 32, 34 years of age. And then he said, oh no, tuck, and the whole page is filled up with the prescription, with all these hypertensive medicine and everything. And then he said, come after 1 week, and same situation. I said, what's going on? And I'm telling my own story, true story. And one day in night, I'm too frightened, and I'm feeling like something is happening in my abdomen. I'm feeling like, say, it's scaring. It's like some bleeding is going on. This is all ideas coming to my mind. The high blood pressure, internal injury, the bleeding, and everything. And then I wake up my wife, I say, we need to go to doctor. Small kid with me, and then we all three left to see a doctor. There was a hospital nearby, and we went there. And this doctor, night duty, thanks to that gentleman, God bless him, he said, oh, no problem. We measure blood pressure. It's like, say, 90 by 140, something like that. Fine. Calm down, lay down. And he made me, lie down on the bed. And he said, just lie down for 10 minutes, close your eyes, and this. And then he, after 10, 15 minutes, he measured my blood 80 by 120. Right. And he said, prescription. He said, when it is first taken? I say, I'm coming home from the office, and this is, okay. No, that's not the way. That's not the way to take the blood pressure, because you are traveling, you are this, you are work condition, many things, anxiety and everything shoots up. and then says nothing, you don't need, you go for vacation for a week. Take leave from the organization, go for a week vacation. See, that is what it is, you know. If somebody comes to us and we measure some parameter which actually are not to be taken in that condition, and you make your decision based on that condition, how you can assure that you will be providing good or right care to that patient? Because the patient was not in that appropriate condition to be taken further for treatment, because your own care plan is now depending on that situation. Perhaps, which actually is not the case. So I think that's very, very important for all of us to recognize what should be the ideal condition for a patient to be seen and prescribe the follow-up plan. Thank you.
Rashmi, you want to add something?
Yeah, I would just give practical examples. That is stress, definitely. I think all of the ART specialists would agree that जो patient बहुत stress में होता है, वो patient कभी pregnant नहीं होता, और जो patient बिल्कुल मस्त होते हैं, दो तरह के patient, एक जो गांव से आते हैं और जो कहते हैं आप भगवान हो, जो करोगे ठीक होगा, वो जरूर pregnant होते हैं, और दूसरे patient जो बहुत well to do होते हैं और बहुत aware हैं, but जिनको चिंता नहीं है, हो नहीं हो, वो patient ज़रूर pregnant होते हैं. जो patient बहुत ही stress में होते हैं, ये क्यों हो गया, वो क्यों हो गया, ये वो नहीं होते pregnant. So I always tell my patients कि stress जो हमारा FSH LH है, brain pituitary से release हो रहा है, that is so close to the amygdala, which is our emotion center in the hypothalamus. So every kind of strong emotion will definitely play a havoc with our hormones. जिस दिन हमारे पास वो stress hormone का measurement आ गया, उस दिन पहले हम वो stress hormone का measure करेंगे कि ये hormone अभी आपका बहुत high है, उसके बाद आप आइए, पहले इसको नीचे करके आइए, because definitely stress relief has to be there. Otherwise, even the IVF is not going to help the patient.
Same like you said, like some patients are at there in every 5 minutes, in 10 minutes, is that medicine I need to take, is that medicine I need to take, I have some pain, I have some pain here, there, like more concern. But literally they could not get conceived. But those are, we have listen to the doctor and just peacefully they sit at home, and when what are the instruction is provided, they followed, like they get conceived. So how do you think that data is the concern for the IVF? Data analysis, data collection?
That is very important. If I talk about the center's perspective, of course, in my center, I will always collect the data in the end of the month, how many patients visited. That gives me an idea about our marketing, whether it is doing okay or not, how many patients converted. That gives me an idea about whether our, reception desk, front desk, whether the doctor counseling, I counseling myself, when the patient whom I have counseled, whether that patient has come back to me or not, tells me a lot. So that data analysis, then we have to take the data about live birth rate, the clinical pregnancy rate, embryo bane ki nahi bane, no, so itni सी चीजें correct होती है. अगर आप हर monthly basis पे data अपना analyze करते हैं, center specific, yes, it is very, very important.
Sometimes we could not able to get the data in properly, and superficially data we just maintain for ourselves, but actually exact what is the patient analysis and how we maintain it, sometimes we are neglecting there. But Dr. Rana, you want to say?
Yes.
You
yeah, I was smiling. So we know no data, no problem. That is the fundamental. Okay. No data, no problem. So just don't have any data, so you won't have any problem. So that's the first phase. Second phase, you have data, but you don't do anything with that. Okay. Now I'm going to the third phase. You have data, you analyze it, but you don't do anything on the outcome. After analysis, whatever you get, you don't do anything. Now come to the fourth phase, which should be the ideal phase. You collect data, you analyze data, and then use that outcome of that analysis to make improvements, right? Now, to reach to this stage of making improvement by using the data you analyze, the most important thing is the reliability of the data which you collect, right? So to minimize the differences and the bias in your data, you need to first write down the procedure for collecting data. How you are going to collect data, what you are going to collect data, what time you are going to collect data. So you have to create the formats. And that will help you to get the right data which you are looking for. That will help you standardize your data which for analysis, and it will help reduce the variation. So irrespective of which doctor coming into a different shift, which embryologist coming to differentiate, it will be the same. They have to just enter it. When you say your live birth rate, or it is a pregnancy rate, or a beta HCG plus rate, or whatever ABC rate, if you don't define what does it mean, when somebody say my success rate is 70%, what does it mean? I don't understand. 70% means live birth, or pregnancy rate, or beta HCG rate?
Beta HCG.
So I'm just, you know, because you know it. I don't know as a public. I don't know as a patient, right? So it should be an open disclosure about that, number one. Number two, the quality of data is very important. So you can defend them. If you say my success rate 90%, you have data collected, demonstrated, evidenced, you can fight with anyone, because your data is of high quality, high reliability. So I think the first thing you should be doing is to create that process of collecting data. Rest will follow automatically. Thank you.
But how QI help?
How QI help? Yes, we have in the standard defined that yes, what you need to do, but how you do it, you can demonstrate. Because see, there may be more than one way of doing same thing. From here, I want to go to Connaught Place, you can take several routes, but the destination is same as Connaught Place. So we don't prescribe that you take from this route and go this, no. We direct, you need to go to Connaught Place, right? How you do, you define, but then you have to demonstrate it. That how you actually, what were the basis of defining that you take this route, and then demonstrate that it works for you. So it may work for you, it may not work for somebody else. So we prescribe the general requirements, but we do not go further prescription of doing it, right? But whatever you do, you write your protocols. You write your SOPs. And then we say, you are following your SOPs. SOP is evidence-based. We call it evidence-based medicine. Nowadays, protocol or best practices. And then you implement those practices, and the rest will follow automatically. So this is how the standards actually helps. And then obviously when our experts visit the facility, they look into it, they ask questions, they interview people, they interview staff. When you talk about, so all those things actually
What is that? What do you feel difference after QA and before QA? Means like
yes, so I may not be the right person, maybe our accredited partners can say that, but yes, before and after accreditation, a lot of difference. First thing is like, we didn't have all SOPs in place. Second, we didn't have some of the infrastructure in place. Common thing like CSSD, operation theater, your operating room, whatever you call it. The quality of air inside, right? CSSD, where you sterilize your equipment, right? The flow, how actually unidirectional or not there. So there are many things which impact your outcomes. You may not be aware of, but all these things come in place. Even simple hand hygiene practices to minimize infection rates, right? So these are the practices which we talk. We interact with the staff, how you do it, really do it. We speak to patients, how your experience was with the center, and whether they were telling you this. Like you have patient rights, right? Everybody knows. And patient rights A, B, C, D, E, whether they are just printed and put on the wall or they are communicated and respected. Like you said in that area, the patient won't accept externally provided material, right? Or on any specimen or something like that. So you need to really take care, because that is one of the right patient choice.
Yeah. We need to always take care of patient.
That we must be. But you should be telling the patients, hey, the chances of getting A positive using this might be less than if you do, but if your cultural things we're not allowing it, we'll go by this. But as a clinical thing, we would suggest if you can go, use this practice.
What center service provide, it's you patient should to know. Means
yes.
After that
you give options.
Yes.
Like surgery,
yeah.
CABG or stenting. You give choice to the patient.
Yeah.
Let the patient decide, but you tell, for this case, CABG is better than stenting, but you choose what you want.
Dr. Asmik, you can say like how this kind of patient come to you, like you have seen a lot of patients, different communities, different physiological aspect, psychological aspect. So how do you find difference and getting them individualized treatment?
Huge difference. I'll just quote one or two. So there are some patients who are always after natural pregnancy. They're sitting at AMH of 0.2. They have been trying for 10 years. And still the IVF is a taboo for them. हमें तो natural करना है. IUI नहीं हो सकता है. तो I always tell them, किस चीज़ से आए हो? गाड़ी से आए हो कि घोड़ा गाड़ी से आए हो? सनलाइट में बैठे हो कि ट्यूबलाइट में बैठे हो? हाथ में मोबाइल पकड़ा हुआ है, मैसेजेस कबूतर से भेजते हो कि मोबाइल से भेजते हो? You know, this is exactly in these same words I talk to the patient कि what is natural? What is natural for you? तो अगर आप बाकी दुनिया की फील्ड में हम विज्ञान का फ़ायदा उठा रहे हैं, हम साइंस का फ़ायदा उठा रहे हैं, हम लाइट यूज़ कर रहे हैं, हम सूरज की रोशनी पे डिपेंडेंट नहीं हैं, हम कार यूज़ कर रहे हैं, हम गाड़ी पे और घोड़े पे डिपेंडेंट नहीं हैं, मोबाइल्स यूज़ कर रहे हैं, then why only medical fields? So this is my way of rudely telling them that please stop going for natural pregnancy. You will waste your time and you will be sitting in front of me after 2 years with donor eggs. So these are the, I mean, there are some patients like that. There are some patients who are sitting at 22 years of age with absolutely no problem, and we are telling them there's absolutely no hurry. I mean, they have been trying for just 4 months, but they are, you know, in some kind of extreme hurry, and we have to stop them. Please don't do IVF. You don't need IVF, right? We really have to pursue them that you don't need. You just try and come back to me maybe after 4 months later. So, I mean, patients are so different, and I'm sure such senior IVF specialists are sitting here, and everybody has seen different varieties of patients, and every counseling is different, right? I mean, such senior people are sitting here, Dr. Nana Patel, Dr. Sunil, Dr. Geeta. I think everyone has seen every color of patient.
They are the all institute in IVF, some of them. So we will wrap up in 5 minutes. So, Dr. Rana, what you concluding with your talk?
Very difficult. I will try. See, to my opinion is that you as a provider, as a healthcare service provider to the patient, you should be focusing on the patient welfare. Obviously, everybody says that, obviously, but I think in letter and in spirit. And when I say patient welfare means that, like you mentioned, madam, you just not jump to do IVF when you can conceive naturally, right? So that's very important, that how really take care of your patient in a right way, right? And doing the right way comes from standardization. I'm sorry keeping repeating, but that's the story, and that's what the reality is. Then when you have a standardization, you have everything written down as a protocol, and you follow them, not just writing down, following them. Your job is much easier, and then you can really say that yes, you follow protocol which are in the best interest of the patient to provide the best or optimum care which they deserve. Yeah. So I think that's the holistic approach I would suggest to follow by the people sitting around the table, eminent people sitting around the table, for their patients. Yeah, thank you.
Dr. Rasmi, final give some conclusion.
So my just thing would be that it should be, of course, patient-centric. Emotions somewhere are missing maybe, but we have to emotionally connect with the patient. And yeah, that's it. Holistic care.
The approach the patient when comes to you means it's like they feel familiar. Means because they coming with a lot of stress, because I also get experience from my side, like patient comes to you like very angry and all the stress, because the social stress and the mental stress, the personal stress, everything. So we need to understand first according the mental stress of the patient and the psychological thought, and how we more counsel the patient before to start treatment and all. So patient-centric, that is only the understand the patient and make individual treatment, tailor-cut treatment to them. That will be the patient-centric. And thank you for all valuable insights, Dr. Rana and Dr. Rasmi.
Thank you so much.
I'm just wrap up the session.
Thank you for the opportunity to IHW and ISAR. Thank you so much.
Thank you. I request all of you to please stay back. We sincerely appreciate your presence, your participations, and your expertise. And now, may I request on stage Dr. Anushka Amlani from IHW Council to felicitate our panelists and moderator. Ladies and gentlemen, please keep the claps rolling for Dr. B.K. Rana. I request Dr. Rashmi Sharma to please step forward. Please put your hands together, everyone. Next, we have Dr. Rakesh Samil, our moderator. Thank you so much for your invaluable contribution. Thank you so much. Ladies and gentlemen, before we go ahead with our last panel discussion, may I request all of you to please scan. There are QR codes right placed on your table. One is to access your e-certificate of participation, another one to access the agenda of the day. So our next and the final panel discussion today focuses on collaboration in IVF coverage, impact and future directions. This session will highlight the crucial role of insurance coverage in making fertility treatments more accessible and affordable. We will discuss innovations and financial strategies aimed at overcoming barriers to comprehensive coverage. Our expert panelists include Dr. Sunil Jindal, andrologist, lab surgeon and scientific director at Jindal Hospital and Fertility Center. I request all of you to please welcome him on the stage. I request you, sir, to please occupy the distinguished chair. Next, we would like to welcome on stage Dr. Rupali Basi, Senior Consultant at the Assisted Reproduction Unit in the Prastha Apollo Hospital, New Delhi. Dr. Rupali is Obstetrics and Gynecology, postgraduate in ultrasonography, certificate course in gynecological endoscopy, and is an IVF specialist in Delhi. She has 18 years of experience in the field of practice. During this tenure, she has helped them recover from their problems. Next I welcome on stage Mr. Ashwin Sapra, Partner, Head Pharma and Healthcare at Cyril Amarchand Mangaldas. He brings extensive domestic and international experience, which spans a period of almost 25 years. He is a member of the firm's corporate practice and is a subject matter specialist in the areas of pharmaceutical, medical device regulatory, compliance, and patent law. Next, we have Dr. Nayana Patel, Medical Director at Akansha Hospital and Research Institute. I welcome you on stage. Dr. Patel has vast experience in her field, having been involved in the care and management of thousands of patients. She offers comprehensive services including premarital and prenatal counseling, infertility treatment, use of assisted reproductive technology, maternity and pregnancy care, normal and complicated deliveries, endoscopic open gynecological, aesthetic gynecology, urogynecology surgeries. I welcome all of you here, and now let's welcome on stage our moderator for this session. Please welcome Mr. Saurajay Nanda, founder of Chambers of Saurajay P. Nanda, also an advocate, Supreme Court of India. Over to you, sir.
Thank you so much. I've got some cheat sheets with me. So it's a privilege for me to be part of this esteemed panel, and the experience we have, we hopefully will leverage that during the course of our discussions today. So just to give a brief overview, the situation here, how we plan on proceeding. One is analyzing what the regulatory scheme is. Right now, currently, there have been some recent developments. So while we are doing that, of course, we leverage the experience on what the situation was before, practically, from a standpoint of patients and the experience. Two is what the situation, given the developments in 2023, what has the changes been from a practical standpoint as well? And also equally, of course, it would have gotten better, but then there still would be some issues which are still there, which needs to be addressed. So that covers that bit of it. And then slowly we'll move on with the situation in the international sphere and what experiences, specific experiences, I believe the Tamil Nadu government has been doing some good work. So we'll touch upon that as well. And finally, we'll close it off with identifying possible future ways in which collaborative model can be leveraged to better the situation, because of course there are a lot of stakeholders at play and they have to come together at the end of the day. So with that, perhaps I'll start with Dr. Jindal on his experiences prior to 2023 changes and what's happening now, and how have we come to this situation, because there would have been quite a bit of collaboration going on in the background, which has led to, in fact, the Surrogacy Act of 2021 as well as the Act of 2021, although they were notified in 2022. Subsequently, in 2023, of course, insurance, the IRDA has issued some notification. So, sir, what was the process? How have we come to this stage?
No, it's extremely interesting that we live in a country of 144 crore people. And this country, if we see the data, I'm going to start over here because it addresses a lot of things. In our country, people who earn 1 lakh rupee a month as a family is only about 55 lakhs. And I'm not talking of the income tax base. Now, IVF per se, or people not having children, is probably the deepest pain a human being could have, personally, and also the way the society takes it. So to have a baby and probably have the biggest miracle on earth, which is IVF, to give them a baby, is a desire of every human being if they don't have a child. But the access of this to every human being is not there, and with a couple of reasons. Like, the first and the foremost is financial. The second is accessibility. The third is the clarity which people do not have, because every patient does not need IVF. A lot of people could be treated very simply to have a baby without IVF. Now, keeping this in mind, when we come on to the structure which has changed, earlier there were no insurance companies which used to insure for an IVF. Now we have a few, but those few companies have so many ifs and buts, which means they will not pay for the drugs. A few people need at least 6 years of waiting time before an IVF cycle could be taken. They have an age cap. Third-party reproduction is not covered. So ultimately, at the end of the day, you have a policy which is not freely available, which is not a part of the general health policy, which is only available to a select few at a high premium with so many caveats that it really, honestly speaking, is not something freely available to everybody. The government schemes now, the second thing is we have about 2,000 IVF centers in the country. I'm talking of them the way you would pay 2,200, 2,200. Now, these are IVF centers. But there is a very large population of gynecologists. Now, this large population of gynecologists could very probably join together with the rest to create something which could be a system where every person could be looked after. Now, insurance companies have started, but the coverage is incomplete. The second thing is the ART bill which had come from the legal framework. Now that has created, unfortunately, a lot of issues, especially in third-party reproduction. I'll give you an example. Now a man today can give only one semen sample for donation. His Aadhaar card needs to be given, which is going to be submitted to the portal. Now a semen sample where a man could give a sample so many times without any surgical or any difficult procedure was available freely at a very low cost. Today the cost of a semen sample, something as simple as a semen sample, if asked from a bank, has gone up. Now you talk of a person who is azoospermic, he can't afford a sperm retrieval. He would prefer having a baby with a donor sample, which is available for 40,000 rupees. Now, just look at the scenario, the way it has changed. Egg donors, their availability. Earlier, an egg donor could give an egg a couple of times. Now she can only give once in a lifetime. And of course, her Aadhaar card again would be given. Now, the problem of giving an Aadhaar card in our country in itself is very anonymous, we all know, because data protection in our country is amazing. So if you look at it at all these standpoints, but yes, the legal framework has done two things. It has put in checks and balances. It has put in reporting, which is very much needed. And this whole data could be used beautifully to understand the demographic and the systems which are there in the country per se. So this has been something which has happened. And that is what I feel the way it is. And there's a lot to be done in the future so that every human being could have the joy of their life, their own baby. From that purpose, I'm just speaking.
I'll then pass it on to Mr. Sapra on his insights as far as the recent developments are concerned.
Thank you. I think Dr. Jindal just mentioned two major points. One was accessibility and affordability. And the second is how these two new regulations have impacted both. I couldn't agree more with what sir has said. In my view, I think as far as insurance coverage is concerned, yes, IVF treatments were not covered previously, thanks to the IRDA circular, which again was subject matter of the ART bill, which required mandated insurance coverage for egg donors and surrogates. So that came out. But I think as far as insurance is concerned, there has to be a look back into ensuring that these treatments are covered. Now the extent of coverage, again, yes, whether it's going to be one attempt, two attempts, gaps between attempts, what is covered, are drugs covered, are procedures covered, because in an IVF treatment, the largest costs are the drugs and the procedures, and please keep me honest on this. Drugs go into thousands or tens of thousands of rupees, and sometimes they're unaffordable. And I'm talking about even the generic ones. Forget about the branded drugs, they're even more expensive. So I think it's time that this industry, the insurance industry, the regulator, patient groups get together and sort of raise this issue that there has to be some level of coverage. And we look at how this is covered in other countries. So for example, Australia has Medicare, which covers part of it. There is private players which also cover. So it's a private plus a government sort of partnership. In the UK, NHS covers it with certain eligibility restrictions. In the US, there are certain states which actually mandate insurance coverage for IVF. So why is it? Because all these countries, even in Belgium for that matter, they cover it. Why? Because they recognize that IVF is an accepted medical treatment. It is like any other medical treatment, whereas here, and again, please keep me honest on this, my experience has been that here the regulators still treat IVF as an experimental treatment, or a treatment which does not give short results. So, and a question which I've asked at other panels is that, does implantation of a stent give a short result? Does any other medical procedure give a 100% result? There will be some, but mostly they don't. So why would this be treated any separate, differently? There can be arguments made that there is a larger objective of controlling the population, but this is not where you go. This is a resort which people come to because they are sort of unable to have children by themselves. It's a very painful, emotional journey. And now coming to the laws, I've been the biggest critic of these laws, start from the day one, and I can go on and on. But I think these laws literally throw out the proverbial baby with the bathwater. The intent is good, to regulate. The intent is to avoid exploitation. We understand that. But if you look at these laws, you just break them down, you are literally making IVF treatment, ART treatments, unavailable, unaccessible. Costs have gone up, as you said. Costs have gone up. Why? Because there are certain quote unquote checks and balances which are nothing but barriers. Availability of eggs or availability of sperm, of gametes. Things like transfer of gametes, I think that's the biggest. And the biggest issue that I have with these laws is that a couple which goes through an IVF process, it's an emotional, it's a physical, it's a financial drain. And when you're going, when you've gone through that, you've gone to your doctor, you are discussing that. So that is protected within the doctor-patient confidentiality. But now you have to go in front of 4 people sitting in a board and narrate your entire private medical history to 4 people with whom you do not have a confidential relationship, who have all your medical data. God knows where that's going to go. So I think these 3 laws are so onerous. I mean, I can think of 20 constitutional challenges. They are pending in the Supreme Court. The government has sort of relaxed something, but I feel that these laws need to be struck down at some point in time, or at least made less onerous, so that, again, like I said, availability, affordability, recognition will become normal and will become easily accessible to everybody. So, I mean, I have more, but I'll just pass it.
Thank you so much. Yes. So I'll just come to Dr. Basi and Dr. Patel. Both I will address the same question, actually. From your
well, I would like to say that when I got this topic talking about insurance in IVF, it's actually a sham. When you look at the normal people, when you look at people going for treatments, if there is a word of infertility in non-IVF related treatment also, the patient is completely denied. If they want to go for a laparoscopy or a hysteroscopy, which might be in a patient who has infertility as well, we can't get it done. So when you talk of IVF and insurance, right now there is a huge lacune, and especially in our country where talking of societal pressure, talking of infertility, which is still, occurs, it's a lot of societal pressure, it's a lot of psychological stress, on the top of it, a financial stress, and if you look at IVF, it is not foolproof. At the moment the patient comes, they don't have a choice. They are never given 100% success rate, never. It's nowhere across the globe. It's not even 80-90% across the globe. When you talk of take-home baby rates, it's much lower. And so patients are kind of in a helpless stage. They don't have much to take. I mean, they don't have much of a choice. They have to take what they have on their platter. And then on the top of it, insurance, yes, I have come across very few insurances like those really premium ones, but that category of people doesn't need an insurance. A person who is able to pay like a 2 lakh premium a year will not want an insurance for IVF. There is a huge number of people who can't afford IVF. Now with the advent of new laws, with the costs going further up, it's finally the patients who are going to bear the brunt. I mean, it's not the doctors so much, because we are anyways going to give the same treatment, whether it's insurance, whether it's non-insurance, whether the patient cannot afford it, or whatever best we can do for it. But finally, it is the patients who have to go for it. When you talk of donor cycles, when you talk of self cycles also. So I think insurance industry should come forward in a big manner and help out people in our country where, where I think it's the need of the hour. IVF is no longer a cosmetic procedure. It's a pure medical procedure, even though the success rates might be variable. But what is the problem? It's for a huge cause. It's for a big cause, I think. Yeah.
So with all these inputs, I have some few more things to add. First of all, the fertility treatment, if we say, used to start in a doctor's office. Not anymore. Now either it starts in an insurance office or a legal lawyer's office, which again is exposure of the couple. whenever we are talking about awareness, we know that everybody knows now IVF, test tube baby, everything. But what is the real knowledge that they have? It's very costly. Sometimes you ask, they say 4 lakhs, 5 lakhs. It's very painful, and it's not giving results. At least people say that I have been told that if you go for IVF, your money goes down the drain. You will spend your money and you will not get a baby. So that clarity has to be now created into an awareness that the results have improved, it's not that costly, and at the same time, it's not that painful, it's become very friendly. The second aspect of money part, like we have young couples who marry late, who want children even later, now they are settled, and as soon as they come to us and we say, you need IVF, oh, I have just got a car, I have just bought a house, I'm paying EMIs for that, how will I pay for IVF? So insurance companies should reach out, like I'm in a 3-tier city, Anand, where people are not aware that so many insurance companies, if they have a good pay check every month, they can be getting this service of payment for insurance for IVF with a small basic amount and then monthly EMIs. Third is the package. I think it should be included in maternity package. Nobody want to say that I'm paying for my IVF treatment because they don't want to even tell that they've undergone IVF. Once they get pregnant, it's like it was natural. Nobody wants to show that I had that issue. So why don't you name it as to-be parents package instead of infertility? So to-be parents means anybody who is getting married is definitely wanting a baby and want to have that maternity package. So if we can include that as a different add-on on infertility, rather than that, name it in a nicer way, the package, there will be more people who would want to definitely go for it. And regarding the legal aspects, I would say that right now, supposing a patient has an embryo transfer this month, the female is 50 years, about to complete. The cycle is negative. She has frozen embryos, but today after 1 month, at the time of embryo transfer, you are 50 plus. I cannot do the embryo transfer. What is the logic behind that? In 30 days, a female becomes ineligible because now she is unhealthy at 50 plus. So if their embryos are frozen, there should be some criteria where we can separate this. And when it comes to surrogacy, I think it's even more painful because they have to go to the judicial magistrate. We have started in Anand. The couple goes, the surrogate goes, and the judicial magistrate can ask any question. For how many years? Why you are going for surrogacy? You don't know this lady, why she is doing free for you? Show me a picture, both of you together before 5 years. I mean, these are the questions. I mean, they are right in their own way because they want to prove that there is no commercial aspect to it. But then when you allow an unknown surrogate, if they've found out somebody who is willing to help, how would they procure a picture 5 years back with that lady? And they run from pillar to post to get all those documentations, number of affidavits, you know how many we need. And ultimately, I think that the patient suffers, and a surrogate, if we did 3 transfer, the couple has managed a surrogate, come to us, got all this essentiality certificate. We have transferred 3 times, one embryo allowed, and she's around 40. Result is negative. That surrogate will never become a surrogate again, and they have to start for that search once again. So there are so many issues in this aspect, and finally, the legal part. No doctor wants to take the responsibility. So they would want a very strong legal firm to take care of it. And the charges which I have heard and which I have seen my patients paying to the legal firm is much more than what a doctor will get from IVF or that delivery, and what the couple would have not given had they not started with the, had they started surrogacy procedure before the legal act came into action. So there are some areas like compensation word should be there. There can't be an altruistic surrogacy. We don't want to make it commercial, but at least a surrogate should be compensated in a way which is reasonable, and if which the government puts an amount like per month for all the well-being over and above her medicines, if you can pay, then this legal aspect will go away and we can do away with major legal costs. So that is what I want to say about this whole scenario.
Thank you so much, ma'am. So from what I take from it is there are two aspects to this. One, of course, the statutes which are in play, which has its own issues, substantial number of them actually, in fact. And the other is, while they do mention the statutes, that insurance has to be provided. Now the question is this: who ensures that this happens? And what kind of product is provided? So I'm just, in fact, as an example, even though the acts came out in 2021, respectively, and while the ART was in 2022, the rules came out. It seems that there was a pushback, which is why, in fact, I think it stemmed from a court order, if I'm not mistaken, that the IRDAI then issued a circular on 10th May 2023, which was again, I think, supplemented in June 2023, saying that, yes, please, healthcare. So now, what does the circular say? It says, healthcare, it says, insurers, please comply. It's as simple as that. Comply to what respect? To what extent? What products are going to be given? Now what's happened subsequently is that, yes, some insurers have come out with products, but of course, as is the case with them, there are a lot of riders, there are a lot of exclusions. So effectively, it's a farcical compliance, which I would say compliance in the sense that the IRDA has itself not set out. With respect to a lot of other aspects, IRDA does regulate, and they actually heavily regulate a lot of aspects of it by setting out what should be the coverages, what exclusions should be available, what should not be there, and your premiums as well. Not to that extent, but at least they give you a broad idea of it. So I believe on that front, the IRDA needs to step up and set out the contours of what kind of policy, what are the different types of it, what would be the parameters of it. So that is, what would be the coverage clause, in fact. So that is an important aspect which needs to be looked into. Now, I'll use that as the basis to move on to the next aspect of it, which I wanted the inputs on. As far as the first aspect is concerned, as I said, is the statutory bit of it, own issues. Now, on that front, I would say the stakeholders are different. The healthcare system and the healthcare providers are very much in play at that point in time, as well as the government. And I'm sure, I don't know to what extent and how many NGOs are perhaps working on this front, and how many policy bodies are working on this front to push the agenda forward. So that's the first bit, which has different stakeholders. Now, on the second bit, I think it's a little wider, because you also have the IRDAI, you have the government, you have the healthcare sector, as well as the insurers. So when it comes to two separate aspects, and I'll run this past everyone, what is the situation today we have on front, on the perspective of being organized about this, about pushing the agendas through, about highlighting the issues which we are facing on both fronts, because that becomes important, doesn't it? We can talk about it, but then who's going to be there, who's coordinating, who's pushing these through? So I just wanted, for everyone's benefit, what the situation is now, and perhaps briefly, what could be the potential way forward on this. With that, I'll hand it over to Dr. Jindal.
So from what I can gather from what the question is, if I'm wrong, you please correct me. What I can gather is that we need insurance, we need a government policy where anybody who ultimately cannot afford and can't even afford insurance is able to be provided through any scheme. And I also understand that what is the way forward in terms of the bodies which are doing. So I'm not really aware of any body which actually is trying to push it through to the government or to the IRDA, or anybody who's actually even representing properly the fact that it is not covered by insurance. So most of the insurance which at the moment is being done is done of the donors, which is mandatory at the time when the pickup is done, and the year insurance, so that after that there is not a problem. But the insurance of a human being who doesn't have a child and doesn't know if he would need insurance is the people who need to get it done. So I'm really not aware personally of anybody who's working towards it, but I personally feel we have so many medical bodies, reproductive medicine bodies, which actually are very active in a lot of areas, but they should make it a point and make it an agenda that this insurance policy should at least go through to these insurances through whatever representation needs to be done.
So just coming back to the IRDA circular, if my memory serves me right, I'm sure everybody knows that there is a larger challenge pending in the Supreme Court, which is there. It was argued there that by the petitioner councils that there are so many provisions of these acts which are inter se contradictory, which are contradictory to each other vis-a-vis the act. Forget about within the act itself, but amongst both the acts, they're contradictory. There is no basis for a lot of these. And the example given was, for example, the requirement to have insurance coverage. The argument was made that no insurance company provides cover for IVF. And when this question was put to the government, it was an immediate knee-jerk reaction. We'll come back to it. And then the next thing happened is that IRDA came back with a circular. So one can say that it was that push which came from the Supreme Court. Similarly, the whole issue about donor gametes in surrogacy, there was a blanket prohibition. Then suddenly the Supreme Court considered it, and then suddenly the government said, okay, we are amending it. Now, a lot of this happened because there is a very considerate council who is representing the government, and she's genuinely trying to see how best a via media can come out. And now the court is looking at individual cases. They've kept the larger consideration open. The government knows that if arguments on constitutionality of these provisions start, there is no ground for the government. The government is only harping on public policy, public interest, but at the end of the day, an IVF patient is also part of that public. And the argument is that the right to have a child, the right to procreate is akin to right to life, which is a constitution protected right. So is the right to privacy, which all of these act, as ma'am said, you have to go and talk about your private medical history to 4 complete strangers who will judge you. They will judge you. Let's face it, they will judge you. Who is a magistrate to ask me questions about my personal life? So there is definitely judicial sort of orders coming through. As far as how to get this across, obviously it has to be a collective of the relevant organizations. You've got FOGSI, you've got all the other doctor organizations. There are other policy groups like Nat Health, which also do a lot of policy work. There are patient groups which would also come forward, but remember, you will also have certain NGOs which will always be against your cause for whatever reason, whether it is whatever, political, vested, or whatever it is. So you have to learn to deal with those, but at the end of the day, there has to be a dialogue with the government. And also the government has to be ready to enter into a dialogue and to understand what industry experts, practitioners say, because, and look at it with an open mind and not just blinkers that somebody said we have to stop this, so therefore we're going to stop this. So it has to be an open dialogue with all stakeholders.
So currently we do have societies like the Indian Fertility Society, as well as, I'm not very well aware of the ISAR Society, but yes, being a member of IFS, we do have an advocacy committee which looks into not insurance as such, but problems being faced by the practitioners because of the law, and we do have regular meetings and do have representations as well as discussions, because still there are a lot of aspects, as you said, in the law which are gray areas, which are not very clear, which are self-contradictory, and it becomes difficult, and especially for the doctors. I think doctors are much more scared people when you talk in terms of laws and all, so they just step back and they're like, okay, we will not treat the patient. I mean, that's the way it happens, and finally it's the patient. But we do have a representation, but yes, but our society has actually not looked into the aspect of insurance, I would admit. But yes, an advocacy committee is there. There's a patient grievance site where patients can kind of, file in their own grievances, as well as for the doctors, I mean, so I think we are coming up. It's not that we are not like that. And indeed, when the ART law was being framed, we had representation from IFS, from ISAR, which was not completely taken into consideration. That is why these lacunae are there. But yes, I think small steps and we would do great, in the long run, and we'll be doing something about it.
Recently, there was an article in the paper that Ayushman is going to cover IVF. It was just mentioned. Now, kidney transplant has also come under the Ayushman. So IVF, I think, is much cheaper infertility treatment. Only thing is the duration we don't know. Someone can conceive within first 3 months of taking the treatment or very first cycle of IVF, and some patients can take even 2 to 3 or 4 cycles. So as Dr. Abha said in the morning, that we can have a chart where we can say high risk, moderate risk, low risk, and based on that, the insurance company can decide the premium, decide the duration, and decide the amount of money that they do the down payment, and then the final amount is decided. But at least it should be accessible to at least the working class people also, who are like good paycheck or a small paycheck, but at least they can pay up the EMIs that are given. And we are talking of a body coming together. I think this is a big platform, IHW Council, where we have the practitioners, clinical practitioners, we have the legal department, and we have the insurance companies. So if all of us were to come together and make a small body which will take the feedback from their particular profession and put it up, and if we can have a legal representation, that would be wonderful. Mr. Kamal, you need to think about it.
Thank you so much, ma'am. And I think from the point of insurance coverage, I believe the process has to be one to IRDA. The IRDA has a discussion. In fact, the stakeholders together have to have a discussion, to be very honest. The representatives from the healthcare sector, the IRDAI, and the insurers to figure out how to put together a product and how to have layered products, different manners of it, different forms of it. As ma'am said, there could be a situation, right, where the process may take 3 months, it may take 9 months, it may take 6 months. All of that has to be taken into consideration. So I guess without the three being together, and the commercial aspects to this as well, because at the end of the day, IRDA cannot, after a particular point, force an insurer to say that you have to give this product for this rate. And also the insurers may not be fully aware of what the requirements are, which would be handled by the Caregivers Association and the Medical Association, I believe. Sorry, Mr. Sapra wanted to say something.
I think
Please.
Add the lawyers as well. Don't forget the lawyers.
Yeah, of course.
because the lawyers can help identify a pathway which then stands the test in court.
Yeah, that's true.
So just to add, my team is here, and we've been following all these cases in the Supreme Court. We've dissected the parliamentary debates. Now, if they had legal input in those parliamentary debates, a lot of the suggestions given in the parliamentary debates were actually against a lot of the provisions in the final act. Now, that is going to come and come in the way of the government now when this matter is argued on merits. That if the parliament has suggested something, who are you to unilaterally go against those suggestions? So that's where the lawyers come in, help draft a policy which stands before a court.
And also, in fact, during that entire process of the interactions between IRDAI and the insurers and the healthcare sector, the lawyers also are important to be involved, because from part of my experience is in insurance practice, but the insurers can be mischievous, let me put it that way, right? A delicate way of putting it. So one has to be very careful in the policy wordings, one has to be very careful in the exclusions, and which is also the reason why IRDAI regulates it so heavily, right? So that is that aspect of it.
I've had this. No, I would agree with you, Mr. Sapra, completely. I've had this amazing journey and experience in getting one amendment done in this ART bill. And we were a few people, but there was a lot of work which physically on my foot I did. And my realization was simple about 4 things. Number 1, people who have crafted this bill do not understand anything about IVF. and their friend philosopher guides are probably the people who themselves do not know about it. Number two, there is nobody who goes, sits with them and opens their mind to, in front of them, to them to understand what really the fact is. Because their original design is that what has been done is right, we've got to protect it. It cannot change. The third thing is, it has to pass through so many different areas where in the amendment the approval has to be done by so many people, and each one has a mindset, how should I stop the amendment? So you actually have to go and speak to everybody, get an appointment, talk to them. And the moment they open their mind, they realize this is incorrect. It needs to be changed. So I think apart from as far as insurance is concerned, I don't know much about insurance. I really don't know much about law either. But what I could understand is that probably people sitting in the place of position and power need to be having, you need to have a conversation with them, whoever is the body which takes it.
Next, I just wanted everyone's inputs on the efforts that have been made by the Tamil Nadu government and what the experience has been on that front on a practical standpoint. So, ma'am, if you can perhaps get the ball rolling.
I'm not much aware of it, but I know that Goa, the IVF is literally being paid by the government to some extent. Sikkim also, I know, they're doing a lot of work giving free IVF to select clinics where their patients can go and do their IVF. They are not creating IVF centers, but the prominent centers, they are giving some fund so that they can do it. I think even in Jaipur there is one center where they do.
Even in Raipur.
Raipur. But Tamil Nadu, the efforts, I'm not very sure about it.
Madhya Pradesh, that's Madhya Pradesh. They have Chhattisgarh, no?
So I think also one other aspect is the financial aspect of it. I believe because nowadays with the InsurTech bit of it, if I'm not mistaken, quite a few insurance companies simultaneously are also allowing for a financial package to be included, the financial support for obtaining the policy. Now, while it does seem to be a step forward, and I'm sure it's a step forward, but these aspects also needs to be looked at very carefully, you know, to be very honest. Again, it's just two different industries and sectors coming together to augment each other. Now, I'm looking at it from that point of view because unfortunately that aspect is there till the time there is a regulation on it or till the time there's somebody overseeing it. Unfortunately, we tend to go down that route which maximizes the profit bit of it. So that is one aspect. And I think the other thing I just wanted to, before moving on to the last bit which I wanted to go to, what is, as far as your practical experience is concerned, now, is there any other methodology of collaboration or is there any other steps which are in the pipeline as far as the industry is concerned, the healthcare industry is concerned, to promote, not only one is of course the aspect of the legal uncertainties which are existing, and of course it's sub judice before the Supreme Court. Now, while it's sub judice as well, there can be attempts or efforts made to discuss the matter with the government, and also the other aspect is the coverages bits of it. Because as practitioners, you all would see at the grassroots level what are the real issues which are being faced by the people who come to you, and their views on it. So just on that front, saying that on that front, whether there is some methodology in which it could be moved forward. I know everyone has addressed it already, just a brief bit on it.
So as far as people and awareness is concerned, probably that's how I would place your question. People are very aware now about IVF, but they're not aware about the law at all. The only thing at the moment I realize they're aware about is Sidhu Moosewala has had a brother. The mother is old, police is coming to her place. There is some problem with the age. And the reason is simple that The law is so complex, so complicated, that even the press cannot understand it. A lot of doctors who are not IVF specialists cannot understand it. A lot of IVF specialists cannot understand it. And more importantly, lawyers don't know anything about it unless and until they have put their brain into it. So because of that, this law per se is worse than the PCPNDT law for people to understand. Now, whether this law should be explained to people or not, and how it should be explained, needs some kind of a system. It may be a podcast, it may be on the YouTube somewhere, it may be on the social media somewhere, or somebody who wants to make people aware of the law from the purpose of what can be done and what cannot be done and what should be done and what should not be done. Incidentally, I'll just say a few questions which people have. Incidentally, I'm also a YouTuber, and every day I get about 6,000 to 7,000 questions in the comment box on my YouTube. So I know exactly what are the pain points of human beings and what they look at as the pain points. 70% do not even know of the problem which they are undergoing after having met gynecologists what their problem is. They do not know the difference between IVF and IUI. They do not know that after 40 years of age, if the menses are on, eggs may stop forming. I'm giving an example. And as far as the law is concerned, I hardly see a question about the law ever. And if the question is, it would be pertaining to something which is trending virally. It may be Sidhu Moosewala or something else. So as far as awareness of the law is concerned, it is not there. As far as awareness of insurance is concerned, it is not there. And the truth is, even a lot of doctors amongst us are not aware. So awareness needs to be there. And I think IHW is something which really could do something really great for awareness over here.
I would just like to put in today only, incidentally, today only we at Indian Fertility Society, we've launched this nationwide program where we have taken up this project to educate people, where IFS is going to be working with the grassroots, with the ASHA workers. Personally, I feel education would go a long way, educating and making the people aware. Now here it is not only the villagers, the people who are uneducated, but also the educated people. I have had people working in good corporate sectors, coming for IVF, coming for egg preservation at 42, 43, and they want their own eggs because they were not aware. So here I think we actually need to target the schools as well. I mean, when you talk of education, educating people, when you talk of making the people aware that these things are true, there is a biological clock, you know, giving good education, even sex education for that matter, in schools, it should start there at that level. You know, even people living in good metropolitan cities, girls are not aware that there is a biological clock. I mean, they are focusing on their careers at that time, they are not bothered about producing babies, and when they want to have babies, it's super fast. 3 months, no child, then they get married. But so, I think all of us as being on the other side, it's our duty to be spreading awareness, to be making people aware that they don't even come to us for treatment like that, rather than, you know, ending up in those kind of scenarios. So, and IFS, big bodies, you know, it has got like 4,000 doctors, 4,500 doctors. SR has also got around 5,000 plus doctors. These bodies can actually also go a long way, along with your personal efforts, you know, as a gynecologist. Yeah.
So he will end. So I think that not only this, but we in a tier city, a couple comes from a village, the husband is 24, wife is 20, married for 2 years. And they are seeking treatment for infertility. We say, no, we cannot treat you. Complete your 21 years of age and then come. But why, doctor? Why am I allowed to get married at 18 and not have a child till 21? My friend is pregnant at 20. Said, no, we will not do your treatment. So we have to teach the law to the couples who come. Husband's age 55 plus, you cannot do it. Why? Who says that? I am 49. No, the law says that. And literally, we have to have a page of the law's important points and tell them that you can search here, it is over there. Okay, yours is a big hospital. मैं छोटे hospital में जाके treatment ले लूँगी. वहाँ तो कोई नहीं ना बोलेगा. So the implementation amongst the doctors, whether gynecologist, IVF specialist, and implementation from the part of the government officials also is not on the same page. Some district will interpret it like this, another appropriate authority will interpret the law like this. So that implementation of this complex law by the government is also a challenge to the government, according to me. So these all factors needs to be looked, and awareness not only amongst the population people, but doctors and government officials is even more important, that all the states have the same follow-up as interpreting the law.
First, awareness. I think awareness has to happen with a positive outlook, which means that assisted reproductive technologies should not be identified as infertility treatments, because infertility connotes a negative sort of value in our society. It's still looked upon as something which is, oh, you can't have children or whatever. So that is one. Second, as far as, again, like I said, interactions, it is up to the industry bodies. It is up to the technical bodies. It is up to the lawyers, the policymakers to interact with the government, to explain to them. Like Sir said, the laws are absolutely, quote unquote, contradictory. You know, it took us almost a week to sort of get our heads around, because you read one section and the next one just completely contradicts it. And the third one literally makes no sense. So I think that interaction has to happen. Policy making has to be a collaborative effort. You know, it's not too late. You know, we know that the objective of the law is to prevent, you know, trafficking of gametes or exploitation of surrogates. We understand that. But again, like I said, and I've used that term before, you cannot throw the baby out, literally throw the baby out with the bathwater. And I say this because this phrase has been used in arguments in court. Everybody laughed about it, but it's got a very serious connotation vis-a-vis these laws. And the final one is, as far as, you know, treatments are concerned, as far as insurance is concerned, there has to be a broader outlook. Yes, insurance companies need to include this in their packages. They can have restrictions. It's there everywhere in the world. The IRDA just needs to look at all the other countries where insurances are being offered. Make it a part public, part private. What you, as ma'am said, you know, put it in the Ayushman Bharat. See how that implements. Again, have a discourse with the industry and with the experts. They are there. But you have to, the government has to look at it with an open mind, not like a diktat that, okay, you know, we have to be bureaucratic about it. Doctors need to practice medicine. Let the lawyers deal with the law, but let the doctors practice medicine. That's what they're there for. Here what is happening is doctors are more worried about 10 forms and the filing of those forms, and like ma'am said, showing the law to 5 people. So these few aspects need to sort of be considered, and they can be done. You know, it's nothing, it's no rocket science.
Thank you. Thank you so much to everyone. I think we've already taken up a lot of all of your valuable times. Thank you.
Check. I request Mr. Kamal Narayan to please come on the stage to felicitate our panelists and moderator. Ladies and gentlemen, let's give a huge round of applause for Dr. Sunil Jindal. Thanks to all of you for your valuable contribution. Please everyone put your hands together for Dr. Sunil Jindal. We'd like to extend a token of appreciation to Dr. Naina Patel. Thanks to Dr. Rupali Basi.
We would like to felicitate Mr. Ashwin Sapra. And our moderator for the session, Mr. Sauraj J. Nanda. Thank you once again for this alluring and gripping session. It was totally thought-provoking. Thank you, everyone. For a group picture, please pose before you leave the stage. Thank you, everyone, once again. Ladies and gentlemen, can we give a huge round of applause for all of them? In fact, for each one of you, for participating, to all our speakers, to all our guests, to all our dignitaries present here, to our moderators, to our partners. As we draw our summit to close, ladies and gentlemen, I hope this day has strengthened the bond and will bind all of us together in some way or the other. Long may our friendship and fellowship continue. Also, I hope the message that we take away is uplifting. We have learned, we have grown, and definitely it was a good opportunity for all of us to network, to learn from each other, and we have exchanged great notes. On that note, humongous thanks to everybody and a huge gratitude that we have within our hearts for everyone who has participated. Thank you so much once again. And now we move on to the awards. But before that, ladies and gentlemen, we would like to present to you once again this very special video of IVF. Kindly have a look at the screen.
Infertility has become a personal public health issue in India. During COVID-19, the inability to access medical care further aggravated the situation for millions of couples. Understanding the seriousness, IHW Council, the leading health well-being advocacy institution in India, realized the need of creating a strong one-to-one networking platform. Since COVID-19 crisis, we are bringing the entire IVF sector together. For the last 4 years, IHW Council is bringing policymakers, regulatory authority, government and private organizations, medical professionals, sexual health experts, infertility clinics, together to discuss the best solutions and way forward, bringing more than 500 experts from the entire ecosystems of IVF to discuss the critical issues and find comprehensive solutions. The 5th edition will focus on in-depth information on the complete ART procedure, precautions and awareness, infrastructure and insurance challenges, building awareness on the entire process of IVF to bring new hope and resilience for all the couples. Welcome to the 5th IVF Summit and Awards.
Check. Thank you so much. I must say that this video truly captures the essence of the agenda that we had today. So ladies and gentlemen, now I am really excited to announce and apprise you of the 10th IHW Summit and Global Leader Awards, which is a flagship event focused towards healthcare sector and sustainability, which is going to be held on 21st September 2024 in the vibrant city of Dubai. This is to introduce our flagship event, and we would like to introduce through a video. So please, once again, glue your eyes to the screen, everyone. Please hit play. Superb. Let's embark on this incredible journey together. So now, ladies and gentlemen, it is my honor to announce that we have our chief guest present. I would like to thank her for gracing the occasion with her presence. Ladies and gentlemen, please give a thunderous round of applause for Miss Sajaya Krishnan, former Joint Secretary of India, retired Ministry of Health and Family Welfare. Ladies and gentlemen, can we give a huge round of applause? I request you, ma'am, to please come on the stage. The entire place is echoing and vibrating your prominence. I request you to please share a few words with all of us.
Good evening, everyone. It's a pleasure to be here, and thank you for inviting me to be here. I'm honored. I think when we talk about infertility and this thing, it's one of the, I would say, a very sensitive topic to discuss about. And as you know, for everybody, from the socio-cultural aspect, when you look at it, fertility is something that, you know, there is a stigma attached to it. There is this thing. Today, when we are here, standing here on July 25th, I think the first test tube DVB had come in, followed soon by our own Kannupriya Durga, and the first scientifically documented case happened in 1978. But we have moved ahead so much in this thing. There are advances technologically. You all have had a full day of discussions discussing what it is. I would only like to say that IVF and ART has dramatically increased all over the world, giving hope to a lot of women and couples who are trying to have a baby. But few things, you know, of course, as speaking from that, I mean, the last session I was hearing about the guidelines and so on. I think the first guidelines came in 2005 and updated in 2013. We have had the Clinical Establishments Act also. We have had the Surrogacy Act. We have also had the artificial releasing, which has been introduced in 21, notified in 22. And in all this, I think a few things, when we talk about it, well, the technology, the advances, those are okay. But a few moral and ethical questions we need to think about, and how it is that, you know, we are moving ahead. Yes, when we talk about this thing, there must be a code of practice, but we are also aware that there is, I would like to say, a gray market operating in this sector, which is not, I think, here maybe you all are the representatives of the well-known institutions and so on, but we are aware how many people are duped into it. But as you go ahead, the only few things that I would think, follow a code of practice, give information to this thing, help the couples avail the best available treatment in how do they decide to choose, and also, I mean, have an informed consent. These are things that can be taken into account. But more importantly, I would like to say that as these institutions which are doing, you do collect a lot of gametes, you do collect embryos. There is also the issue of research. Can we look at that area also where we could, you know, how do we use, because there is also the question of, say, genetic screening. Also, embryonic stem cell therapies are now talking about, the nation and others are talking about it, can we have a look at those also to do that out? And keep in mind that this whole thing is about human values, human thing, because we are starting with the very first of life. So if we can keep these aspects into it, I think that's the finest. This is the best thing that is happening for and providing hope. So keep up the hope, keep up these things, but also keep in tune with the ethics that need to be taken care of. That's all I would like to say. You'll have had a long day, I don't think. Thank you so much.
Thank you, ma'am, for sharing your valuable insights. I request you to please stay back to felicitate the awardees. And now, ladies and gentlemen, as you know, we have the awards. Are we all ready? But for this, show some energy. Let's raise the tempo of this beautiful place. So, ladies and gentlemen, we are starting. The red carpet is laid, the trophies are polished, and the recipients will be celebrated. It's a wonderful moment, and we would like to acknowledge those who have contributed their best, those who have blazed the trail we all follow. So the first category of award is Outstanding IVF Clinic, Silver Award, which goes to I request Mr. Kamal Narayan also to please join us for the felicitation. And now the award goes to Mom IVF. I request you to please give a big hand. Someone from Mom IVF kindly come on the stage. They specialize in offering services in infertility, gynecology, obstetrics, and related treatments. Let's keep the claps rolling, everyone. Let's motivate each other. Let's encourage each other. Because the true essence of awards is in the audience when they applaud, when they raise a cheer for everyone who's coming on the stage. Thank you. Congratulations. Next we have Silver Award for the Outstanding IVF Clinic, standalone again. We had 2 outstanding awards in silver category, and this goes to Sri Chakra Fertility. They offer world-class AI integrated, patent-friendly and customized treatment. Congratulations and really thanks to everyone who's applauding, especially from behind. Again, we have the Silver Award for the Outstanding IVF Brand, this time Metros, and the award goes to Nova IVF. They are among the largest service providers in fertility treatment. Congratulations. Now we have the Gold Award for Outstanding IVF Brand Metros, and the award goes to Birla IVF. Birla Fertility and IVF aims at transforming the future of fertility globally. Just to give you the outline, in some categories we have silver and gold, and in some we have bronze, silver and gold. So we move on to the Silver Award for Outstanding IVF Brand Non-Metros, and the award goes to Birla IVF. Again, this is a state-of-the-art fertility clinic known for modernizing its technology. Congratulations. Next we have Silver Award for Outstanding Patient-Centric Care in Fertility. And the award goes to Indra IVF. Congratulations. They are the pioneers in exceptional patient-centered fertility care. Congratulations. Next we have the Bronze Award for Outstanding Affordable ART Provider, and the award goes to Mom IVF. As I mentioned, they specialize in offering services in infertility, gynecology and obstetrics related treatments. Come on, ladies and gentlemen, one hand against the other. Please don't stop blowing. Next, we have Silver Award for Outstanding Affordable ART Provider. And the award goes to Roots IVF. Roots IVF and Fertility Institute plays a generous role in finding solutions. We have Silver Award for Outstanding Patient Advocacy in Fertility, and the award goes to JB Chemicals. JB Pharma is among India's fastest growing pharmaceutical companies and a prominent player. Congratulations. And they get the gold. They are experts in patient care and clinical excellence. Thank you, congratulations. Next award goes to Silver Outstanding IVF Chain, and it goes to Bloom IVF. And the next is Gold, ladies and gentlemen, Gold Award for Outstanding Initiative for Public Awareness, and the award goes to Nova IVF. Congratulations. Now this award is Silver for Outstanding IVF Chain, and the award goes to Cloud9. Let's give a big hand for them. They focus on providing personalized support, clinically reliable results. Thank you, congratulations. Our next award is Silver Award for Outstanding IVF Chain, and the award goes to Nova IVF once again. They offer state-of-the-art technologies such as vitrification for preserving embryos and eggs, the Gold Award for Outstanding IVF Chain goes to Indra IVF. They are pioneering in accessible and affordable fertility care across India. Congratulations. Next is Bronze Award in Excellence in Embryology, and the award goes to Rashi Kannoi. Please put your hands together, everyone. Next is Silver Award for Excellence in Embryology, and the award goes to Dr. Rakesh Samal. He is the Director and Senior Embryologist, Imprimis IVF and Fertility Center. Congratulations. Next is Silver Award in Excellence in Embryology, and the award goes to Dr. Sujata Ramakrishnan. Again, we have the Silver Award in Excellence in Embryology, and the award goes to Mr. Ajay Srivastava. Mr. Ajay has published various studies in IVF. He has done more than 20,000 IVF cases with 60% success, and currently doing 1,000 to 2,000 IVF cycles annually. Next we have Gold Award for Excellence in Embryology, and the award goes to Dr. Pranay Ghosh. Big round of applause, everyone. Dr. Ghosh is a distinguished senior embryologist with over 1.5 decades of clinical experience in the field of reproductive medicine, having performed over 5,000 independent oocyte retrievals and over 8,000 embryo transfers. Next we have Silver Award for Excellence in Laparoscopy, and the award goes to Dr. Vaishali Sharma. With more than 20 years of experience, Dr. Vaishali is a national award winning laparoscopic surgeon and IVF. We have Silver Award in Excellence in Fertility Counseling, and the award goes to Miss Saranya. Big hand, everyone. Now the next award is Bronze Award for Excellence in Reproductive Endocrinology, and the award goes to Mom IVF, Dr. Purnima Durga. She is the Chief Fertility Consultant at Mom IVF and Research Center, Hyderabad. A successful fertility specialist treating cases of thin endometrium and PRP, and an expert in treating various failed IVF patients. Next is the Bronze Award in Excellence in Reproductive Endocrinology. So difficult to take the names, I'm so sorry. Not from the medical field. And the award goes to Dr. Nandini Devi. Dr. Nandini Devi is a gynecologist, obstetrician and infertility specialist in Thousand Lights, Chennai, and has an experience of 15 years in these fields. She practices at Indira IVF Fertility and IVF Center in Thousand Lights, Chennai. Next is Silver Award for excellence in reproductive endocrinology, and the award goes to Dr. Parul Prakash, a highly successful infertility specialist treating blocked tubes with either performing laparoscopic tuboplasty, correction of blocked tubes, or offering IVF. She has an illustrated academic career. Please, can we raise the decibel level of the room, ladies and gentlemen? Next is Silver Award for Excellence in Reproductive Endocrinology, and the award goes to Dr. Shalu Gupta. And now we have the Gold Award for Excellence in Reproductive Endocrinology, and the award goes to Dr. Jayesh Amin. Ladies and gentlemen, now we have some special awards, and this one is for exemplary achievement in reproductive medicine. Please put your hands together for Dr. Aviva Pinto Rodriguez. Dr. Aviva is a fertility consultant at Nova IVF Fertility. She has a wealth of over 25 years experience in the field of reproductive medicine. His areas of interest include mild stimulation protocol, especially in patients with diminished ovarian reserve. We move ahead, and the next award is Pioneering Leadership in Reproductive Health, and the award goes to Dr. Bharti Dorpatil. She has been the forefront runner in prestigious medical organizations like IMA, FOXY, IFS, POX. She was involved in many patient education programs like health tasks, talks, and blogs about women's health, infertility, cancer prevention, education, breast cancer awareness, menstrual hygiene, etc. Next, we have Legacy of Excellence Award, and the award goes to Dr. Geeta Khanna, currently the director and chair of Ajanta Hospital and IVF Center in Lucknow, UP, with previous roles as head of the Department of Obstetrics, Gynecology at Awadh Hospital and Heart Center, and consultant obstetrics, gynecology at Awadh Nursing Home in Lucknow. Lifetime Achievement Award in Reproductive Medicine. Any guesses, ladies and gentlemen? Okay, let me announce the name, and the award goes to Dr. Mirudu Bashni Govindarajan. She's an extensive 42 years plus of experience in the fields of gynecology and infertility. She's also a trained and highly qualified clinician with the necessary exposure, education, and experience. She comes with an experience of 4 decades in the fields of gynecology and infertility among women. Ladies and gentlemen, to know more about her, I request all of you to kindly have a look at the video. I request both of you to please come this side. We have this video playing for her.
And ISAR for conducting the 5th India IVF Summit on July 25th, 2024.
Could you please play it again?
The highlighting and the emphasis on the necessity for good, ethical, and cost-conscious, dependable IVF units is very welcome at a national level today. Today, units that are providing IVF procedures alone cannot be considered as complete units for treating infertility. A complete reproductive medicine unit should consist of other specialists as well. Reproductive surgery has become a necessary part of this treatment, and people who have special emphasis and training in reproductive surgery should be part of the team. Besides the surgeon and the physician that's taking care of reproductive medicine, you should also have consultants who are specialists in endocrinology, diabetes, metabolic diseases, and such things. And the rest of the team, which should consist of dietitian, highly trained physiotherapists, and counselors, psychologists, psychiatrists, and etc., are also very necessary to have a complete team. So when you're forming an IVF unit, it cannot be an IVF unit alone. A reproductive medicine unit should be complete with all the necessary trained individuals and professionals. We started our IVF unit back in 1994, many decades ago. At that time, there were very few units in India and very few places where you could go to train an IVF unit or train your staff in that. We were lucky to have the guidance of Professor Ratnam of Singapore, who had delivered the first IVF baby in all of Asia. Wholeheartedly, he provided us support to train our embryologists, our clinicians, and the rest of our IVF unit staff as well. And he monitored us for a period of time and was here for when we were actually opening the unit as well. And subsequently, we had specialists from several different countries help us in the quality checks and the rest of the areas. Today, we have a complete unit that's been functioning for several decades now. And our unit has also had another distinction of being certified by National Board for its training programs very early on in the game. And today our specialists who are trained with us are there in almost all areas of the country, from Delhi to Kanyakumari. And most of them are doing a very ethical and professional kind of services in their own areas. Currently, we are working with Motherhood group of institutions for the last several years, and Motherhood has taken away the job of administration from our hands and management of the unit from our hands, and having less of administration and management, we are able to focus more on the clinical side of it and able to provide our patients a much more focused treatment. Finally, I thank you all for recognizing our institution, and I accept the award with all humility on behalf of my entire team, both management and clinical. Thank you.
Fabulous, ladies and gentlemen. Can we give a huge round of applause for her years of contribution? And currently, she's a part of Motherhood Hospitals. Thank you so much, ma'am, once again. We have this special recognition. We have few more awards to go. We would like to felicitate Cooper Surgical. I request someone to please come from Cooper Surgical on the stage to get the award called MedTech Excellence in Fertility. Ladies and gentlemen, please give a big hand for all of them. Next, can we have representatives from Samad Life Sciences as they're getting the award Pharma Excellence in Fertility. so much. And another special recognition goes to Imprimis for outstanding IVF clinic as standalone clinic. Ladies and gentlemen, this was the last award, so can we raise a cheer louder than ever? Please everyone. For everyone who received the award, thank you so much to all the awardees, to all the participants. Thank you so much to both of you. Please take your seat. I request all the winners to kindly come on the stage for a group picture. I request all the winners, everyone who has received the award, to kindly find a way to the stage, and let's pose for a big grand picture, and let's leave an everlasting impression that we're going to cherish forever. So please everyone, get on the stage. And let's pat each other's back, be proud of it. It's a moment of humility and pride in all of us. I'm sure it's a big special moment. Let's celebrate it. In the meantime, I would also like to once again thank and show the gratitude to our co-host, ISAR, Indian Society for Assisted Reproduction, our partners, Bharat Serums Private Limited, 5 Cooper Surgical, Imprimis IVF, Summit Life Sciences, Evagenic, our legal partner, Trust Legal, communication partner, Teamwork Communications, digital media partner, IHW TV. Thank you so much. Congratulations to all the winners tonight. Thank you so much once again. Your dedication and achievements are truly, truly inspiring, ladies and gentlemen. Once again, can we just make some noise? Resounding round of applause for ourselves, rather. Please, everyone. Thank you for making it a grand success. Yet it speaks the volume of hidden sentiments within the heart, and lots of gratitude to everyone. Thank you so much once again. As they say that investment in knowledge pays the best interest, so we like to conclude it like this here. Designated area outside the hall. Please have your refreshments, have your tea and coffee. We have high tea. Thank you, ladies and gentlemen. Once again, this is your host, Kamal Homi Mistry, signing off.